AAAS División del Caribe. Estoy muy contenta de darles la bienvenida en nuestro segundo día. Ayer fue un día espectacular, tuvimos casi 4,000 viewers. Los que se pudieron registrar recibieron hoy la agenda actualizada. El tema de ayer tocó cambio climático, colaboraciones en el Caribe y tuvo una audiencia bastante wide. Voy a cambiar al inglés porque tenemos invitados en inglés y muchos de nuestros viewers también hablan inglés. Good afternoon. Welcome to the second day of the AAAS annual meeting. Yesterday we had an incredible audience of about 4,000 people watching through different media platforms. Today we'll be focused mostly on public health, and we have an amazing panel of women, extraordinary women, who will be talking about COVID-19 efforts in their local communities, mostly in Puerto Rico, but also in other areas of the Caribbean. And moderating today's session, we have two colleagues and friends, Dr. Abel Baerga Ortiz and Dr. Carlos Ramos, who will be talking with these amazing women and trying to get, good advice for folks watching us today and how we will move forward from this status of awareness. Also, we will celebrate another amazing woman, Lucy Gaspar, a former science teacher in Puerto Rico, a model for many professors. Her daughter will be giving the medal, recognizing Professor Elizabeth Torres from Jose Julian Acosta School in San Juan, who was awarded the Lucy Gaspar Medal this year. And we will also award an amazing graduate student who has been tirelessly working through the pandemics and through the earthquakes, the best poster presentation as the Robert Loris AAAS Award. The first place will be $500 cash, the second place will be $300, and the third place $100. To all speakers, we are giving as a gift what we call the Domiku. It's a domino set made with local materials and local art. And this time we selected the Capilla del Cristo. It's a symbol, a cultural symbol of Old San Juan and of Puerto Rico. It's a chapel that has been around for 250 years. It is also a symbol of hope. I just wanted to thank you before going forward to today's session on COVID-19 to thank the board of directors of AAAS Caribbean. They have been doing an amazing job behind the scenes, and I wanted to thank them all. Also our partners, Vistazo la Ciencia, Dr. Felix Rivera Mariani, who is doing all the streaming, and Henrik Rivera from Eco Exploratorio, who is hosting the Zoom, and Ceiba Interpreters for giving us simultaneous sign language interpretation, and all the folks out there, Ciencia Puerto Rico, and all our reviewers of the student sessions that have helped us during the 2 days, our deep thanks. And with this, I pass the presentation to Dr. Abel Baerga, who is introducing the first speaker, Fabiola Cruz.
Thank you, Filipa. I hope everybody can hear me. I'm also very excited to be here. This has been a wonderful conference so far. Yesterday's discussion on climate change and disaster relief and preparation was really a tremendous day for science, and also the student presentations were amazing. And today we have another banquet, as Filipa was saying, of great presentations. I'm going to be talking in English in recognition of some of our guests who are from non-Spanish speaking countries along the Caribbean. We welcome them to this conference, and we're very happy that they have been able to join us. This morning, I have the honor of introducing the first speaker, which is Fabiola Cruz Lopez. And Fabiola Cruz Lopez, if you don't know this name in Puerto Rico by now, you should, because she's been extremely busy and has had a tremendous impact on the management of the COVID-19 epidemic, especially from the epidemiology side. She has led the efforts to organize the contact tracing in response to the COVID-19 epidemic from the municipalities upward towards the central government. And so, so we are very, very happy and very proud to have Fabiola as the main speaker in this first session. Fabiola is a native of Villalba, Puerto Rico. She studied a bachelor's degree in biology in UPR Mayagüez, where she did some research projects in Mayagüez. Later on, she joined the Graduate School of Public Health, where she did a master's in public health with a specialization in epidemiology, which is what pretty much makes her be capable of having the impact she's having today. After finishing her master's, she joined the School of Medicine in Ciencias Médicas for a PhD in microbiology, and right now she's pursuing a joint degree, a PhD in Ciencias Médicas, together with an MD degree from Universidad Central del Caribe. And her research project revolves around the evolution of both mosquito-borne viruses and mosquito-borne diseases, which are very common in the Caribbean. During the epidemic, as I was saying, she put some of her studies on hold to go back to her native Villalba to start the contact tracing efforts at the municipal level, just in her hometown, just in her community. But later on, that caught on, and the media caught on to what Fabiola was doing in Villalba, and fairly soon, many other municipalities copied the model from Villalba, and it was so successful in having initial control of the epidemic that Fabiola was hired by the health department to become the director of the municipal system for case investigation and contact tracing, where she coordinates all the municipal efforts. Fabiola reminds us that epidemiology and the control of epidemics is not something that can be done from an air-conditioned office in San Juan. It has to be done with boots on the ground, with people in the municipalities and in the community level. Without further ado, and with a great pleasure, I leave you with Fabiola Cruz Lopez. Fabiola.
Hi. Thank you, Abel, for that introduction. Good afternoon, everyone. My name is Fabiola. It is a pleasure for me to be here as a speaker, as a public health professional, as a scientist in training. I'm doing my PhD. The president, Dr. Godoy, is part of my committee. So I'm very happy to be here. I'm going to be offering my lecture in Spanish, but please feel free to ask any question in English. Share my presentation here. Bien, ahora sí, buenas tardes a todos. El Caribe, toda la comunidad científica, AAAS, gracias por la invitación que me han hecho para estar aquí con ustedes en este momento tan importante y luego de tanto que hemos hecho en el país. Ya han sido casi 8 meses desde que comenzamos este cambio de estilo de vida, este nuevo reto para todos como país, como planeta. Así que espero que hoy se lleven con ustedes una visión de lo que ha sido esta respuesta de Public Health, de salud pública en Puerto Rico, cómo estamos hasta ahora, qué nos falta, hacia dónde nos dirigimos. Diciembre de 2019, ninguno de nosotros pensaba lo que venía. Yo estaba haciendo planes de mi tesis, estábamos terminando fiestas navideñas, pensábamos que quizás teníamos la oportunidad de que el próximo año, ¿verdad?, íbamos a compartir nuevamente con nuestras familias, iban a hacer nuevas fiestas, hicimos planes desde ese entonces para las próximas Navidades, y el mundo cambió. Un virus, algo tan pequeño, detuvo el mundo. Como microbióloga, siempre pues estudiábamos, ¿verdad?, las pandemias y decíamos, wow, qué cosa más impactante, como una partícula viral puede causar estas pandemias que leíamos en el libro, y nos ha tocado a nosotros ahora hacerlas. El mundo se detuvo, pero la ciencia no. La ciencia ha demostrado lo importante que es desde secuenciar en semanas. Nunca antes ocurrido en otra pandemia, secuenciar en semanas, desarrollar diagnósticos, la carrera contra la vacuna, establecer sistemas de rastreo de contactos, no nada más ese recogido de datos a nivel de computadora, sino también los ingenieros desarrollar aplicaciones, distintas cosas para poder trabajar duro con esta pandemia. No así en esta misma nivel han trabajado todos los gobiernos. Yo creo que algo que nos ha enseñado esta pandemia es que los problemas de salud pública y las emergencias en salud pública se deben trabajar desde lo interdisciplinario. No son las entidades de salud ni solo las de ciencia los encargados de trabajar estas pandemias. Hay que trabajar unidos desde la economía, el trabajo. Ya prontito vamos a ver cuáles son esos roles importantes de la salud pública y por qué es importante que expandamos la visión que tenemos sobre cómo trabajar estas emergencias para triunfar en un futuro, porque definitivamente esta no es la primera pandemia, no va a ser la última, vienen muchas más y es responsabilidad de nosotros, quizás no es ahora en este tiempo que estamos, dejarle ese conocimiento a todos los que vengan, a todas las generaciones que vengan, para que puedan manejar futuras pandemias de una forma más eficiente y mucho más rápido con el fin de salvar vidas. En Puerto Rico, en marzo, abril, Departamento de Salud, ya dirigido en abril por el doctor Lorenzo González, continúa lo que era preparar, ¿verdad? Una respuesta que no se tenía, no estaba establecida, ir preparando toda esa documentación, todas esas vigilancias, todos esos esquemas, tanto a nivel central como al nivel regional. Desde el nivel central se une también lo que es el Instituto de Estadísticas de Puerto Rico. En Villalba comienza un sistema municipal todavía no integrado a la respuesta del nivel central y regional del Departamento de Salud. Ese sistema dirigido pues por esta servidora, pero también con un grupo de profesionales bien comprometidos a nivel municipal, que estábamos ahí, ¿verdad? No nada más llevando una respuesta epidemiológica, sino también humana. Fue clave la unión y la colaboración con lo que es el Fideicomiso de Salud Pública, dirigido por la señora Lucy Crespo y también el doctor José Rodríguez Orengo. Definitivamente fue uno de las claves para poder continuar en esa colección de datos. El fideicomiso nos propuso, el fideicomiso estableció lo que era la plataforma para comenzar esa colección a nivel municipal. Desde el nivel central, la doctora Encijar Hassan comenzó las vigilancias, tanto de hospitalizaciones, de muertes, de primeros respondedores, investigaciones de casos desde el nivel central, y la doctora Jessica Irizarry tomó en sus manos lo que era el rastreo de contactos desde el nivel central. En ese momento, para que tengan una idea, el rastreo de contactos contaba con cerca de 20 personas, que quizás en ese momento iba a ser suficiente, pero jamás iba a poder soportar todo lo que podía venir en los futuros meses. A nivel regional, también dirigidos por la doctora Encijar Hassan, pues se comenzaron a hacer esas investigaciones de casos, a darle soporte a los hospitales, a hacer los referidos, y comenzamos a identificar lo que fue esa respuesta municipal, la importancia de la misma y de abarcar, de añadir un nuevo nivel a lo que era el Departamento de Salud. Aquí nace lo que nosotros conocemos como SMERC, que es el Sistema Municipal de Investigación de Casos y Rastreo de Contactos. SMERC realiza lo que son todas las investigaciones locales de su municipio, de los casos, hacen ese rastreo de contactos, educan, monitorean que los negocios, que los comercios estén cumpliendo con las órdenes ejecutivas y realizan esa respuesta humana y esa respuesta social que tanto se necesita. Bien importante, una vez entran los sistemas municipales, al día de hoy se cuenta con sobre 600 empleados, lo cual definitivamente ayuda a que podamos tener una mejor cobertura de las investigaciones de casos que se están dando y una mejor respuesta, mucho más rápida y eficiente. A nivel central, quiero que vean la expansión que hemos tenido a partir de julio. Ya desde un poquito antes, los equipos de tecnología, de esa información de cómo se iban a estar transfiriendo esos datos, de análisis y de calidad de los datos dirigidos por el doctor Valencia y por el señor Joshua Villafañe, comenzaron a establecerse. Entramos en lo que fue el bioportal, una plataforma que ha crecido mucho, ha evolucionado muchísimo. De hecho, la respuesta municipal se montó dentro de lo que es el bioportal. El bioportal es donde los laboratorios reportan directamente y una vez el caso sale, ya el caso tiene su récord en el bioportal y es ahí donde nosotros guardamos todas las entrevistas con todas las variables de lo que se está haciendo a nivel municipal. Los municipios tienen una peculiaridad. Todos trabajan en la misma base de datos, incluyendo la base de datos del fideicomiso con los municipios que ya estaban. Sin embargo, fuera de lo que es la colección de datos, todos tienen su forma peculiar de trabajar, ¿verdad?, con sus comunidades y su forma distinta. ¿Por qué? Porque dentro de Puerto Rico hay diversidad y los pueblos, no todos, esa demografía, la composición no es la misma. Así que definitivamente hay que personalizar esas respuestas a nivel local para lograr tener un mayor impacto. Luego entonces comienza lo que es la vigilancia de aeropuertos dirigida por la epidemióloga Miriam Ramos y Zaira Quianes. La iniciativa de envejecientes dirigida por la doctora Idania Rodríguez. Tenemos la oficina de investigaciones. Me quito el sombrero con esta oficina dirigida por el señor Jesús Hernández, en donde han hecho más de 200 intervenciones en negocios, llevando ese cumplimiento. Cada vez que cierran un negocio, un comercio que no está cumpliendo, no pienso solamente en el comercio, pienso en todas las vidas que se están salvando, en todas las infecciones que prevenimos en ese momento, aunque no las veamos. Yo traduzco cada uno de los esfuerzos a eso. La vigilancia de aeropuertos ya ha utilizado lo que es el non-fly list, donde se ponen personas que han resultado ser positivos en Puerto Rico y no los dejamos salir de Puerto Rico a los Estados Unidos o a otro lugar y viceversa. Aquí también se suma lo que es el SAR Alert, que le da esa ayuda. SAR Alert es un sistema computarizado que envía mensajes y le da seguimiento a las personas que vienen de viaje. COVID Patrono. COVID Patrono es otra de las iniciativas dirigidas por la doctora Rubí Serrano y aquí ya junto con la orden ejecutiva todos los patronos reportan aquellos casos positivos que tienen o personas con síntomas y se les orienta y se refieren entonces a los equipos de investigación. Y finalmente, la vigilancia de escuela, algo bien importante. Sepan que se está trabajando duro con esto, está a cargo del epidemiólogo Kevin Colón y de la demógrafa Wilmarí de Jesús. Ellos están entrando todos nuestros estudiantes al sistema, no tan solo los estudiantes, sino los familiares, para que una vez las escuelas abran pues estos sistemas de la mano con lo que es SMERC, el sistema municipal, podamos proveer esa vigilancia y realizar cernimiento en las distintas escuelas de nuestro país, no tan solo públicas, sino también privadas. Incluso ya hay universidades que se están integrando a lo que es el sistema y esta vigilancia. Y claro, yo creo que uno de los pilares en lo que es la educación y promoción dentro del Departamento de Salud, tenemos la oficina dirigida por Michelle de la Cruz fuera, pues claro, Fideicomiso continúa dándonos todo ese apoyo. Ciencia Puerto Rico, soy estudiante, soy parte de ellos y con ellos fue que comenzamos a publicar. Muchos estudiantes, muchos profesionales han utilizado sus herramientas para poder llevar el conocimiento. Igualmente las campañas de educación que están dirigiendo, sin dejar esto a un lado también lo que es COSACO, un grupo de profesionales bien comprometidos de distintas especialidades que siempre están ahí para dar el apoyo, para llevar la educación dirigida por Frank Avilés, el doctor Jaime Claudio y un sinnúmero de otros profesionales que están incluidos en lo que es esta respuesta. Y muchos otros, vistazo a la ciencia, ciencia en tus manos, que definitivamente han ayudado. Ustedes son parte de una educación que damos, una persona que impactamos, alguien que empoderamos, es muchas vidas que salvamos. Nunca menosprecien el impacto que puedan estar causando. Salud pública, se trata de esto. Salud pública, no vemos las vidas finalmente que salvamos, pero lo sabemos porque lo hemos estudiado, porque podemos ver cómo se ha comportado en otros países. Así que gracias por el trabajo que se está haciendo. En Puerto Rico se está haciendo muchísimo, la respuesta se ha fortalecido, no es la misma que de marzo, pero vamos a estar viendo algunas limitaciones que todavía tenemos y en qué aspectos todavía podemos mejorar. En Puerto Rico ahora mismo, a nivel mundial, ya han sobrepasado los 45 millones de infecciones, increíble. Yo me recuerdo cuando comenzamos todavía que yo veía esos números subir de 8,000 casos, ya han pasado 45 millones, 1.1 millones de muertes. En los Estados Unidos, más de 260,000. Para que ustedes tengan idea del impacto, enfermedades del corazón al año causan 600,000, al igual que el cáncer, que ya quedaría en la segunda posición, ¿verdad? De las principales causas de muerte. Luego entonces vienen accidentes con unos 150,000 aproximadamente. El COVID en 8 meses ya ha causado más de 260,000 muertes. Esto es preocupante, esto es para tomarlo bien en serio. No es influenza. Influenza y neumonía al año en Estados Unidos causan aproximadamente 50,000 muertes, lo cual definitivamente estamos frente a un reto bien grande de nuestra humanidad. En Puerto Rico ya los casos han sobrepasado los 30,000 casos confirmados, al igual que también los 30,000 casos probables. Las muertes, 794 muertes y hospitalizaciones que nos hemos mantenido en estos últimos días, en las 395. La curva epidemiológica, estos son los datos del Instituto de Estadística de octubre 14. Increíble, ¿verdad? Lo que nosotros pensábamos que había sido ese primer pico en marzo. No me gusta hablar de picos cuando estoy hablando de la epidemia en curso, sino pues al final, luego cuando veamos lo que realmente transcurrió, pues entonces discutiremos bien esos picos reales que tuvimos en la pandemia. Pero luego de que comenzaron las flexibilizaciones, pues definitivamente hemos visto un aumento increíble de los casos, y esto también, pues claro, en base a la movilidad. Ahora mismo, cuando comenzaron las flexibilizaciones en junio, el sistema de rastreo de contactos tenía fecha de comienzo en julio 1, el sistema de rastreo de contactos municipal. En julio 1, finalmente se estableció bien en agosto 1. Y pues ese aumento de los casos fue bien preocupante. Levantar un sistema, ¿verdad?, dentro de la batalla. Esto es, como yo decía, entrenar los guerreros en la batalla, pero lo hemos logrado y entiendo que han hecho un excelente trabajo en los municipios y todas las respuestas que se han estado integrando. La distribución de edad y sexo. En sexo estamos más o menos bastante igual, sin embargo, en la edad vemos cómo la clase trabajadora, y es de entenderse cómo la clase trabajadora son los que más pues han estado afectados, ¿verdad? Los más que, porque están en ese constante movimiento en sus lugares de trabajo cerrados, y esto va bastante acorde con los datos que hemos levantado por parte del sistema municipal. ¿Por qué es importante hacer una investigación de casos y un rastreo de contactos? Me decían, Fabiola, agosto no es muy tarde, julio no es muy tarde para levantar ya la respuesta a nivel de Puerto Rico. Pues no es tarde. ¿Por qué? Porque nosotros estamos cortando cadenas de transmisión, y quizás no cortamos 200 cadenas anteriores, pero podemos cortar las próximas 1,000, y de esta forma podemos disminuir la cantidad de casos que tenemos y marcar pues ese comienzo de aguantar la transmisión del virus en nuestras comunidades. Se identifican los casos y los contactos a tiempo, o por lo menos ese es nuestro fin. Muchos los identificamos a tiempo, todavía hay algunas limitaciones. Identificamos asintomáticos. No hay otra forma de identificar asintomáticos que realizar este rastreo de contactos o realizar lo que es el screening a nivel de población para poder continuar identificando estos casos. Identificamos lo que son los brotes y los podemos, ¿verdad?, describir. Se proveen los recursos dirigidos a las familias afectadas, se promueve la salud y se educa, y claro, promover esas medidas de prevención cada caso que investigamos, cada caso que llamamos es una persona más educada sobre las medidas que deben seguir. Desde agosto 1, nuestro sistema ha realizado más de 14,000 entrevistas a casos confirmados, más de 9,000 a casos probables. El último reporte que presentamos, que comprende el periodo de septiembre 15 a octubre 15, cubrimos el 86% de las entrevistas asignadas al sistema de SMERC. ¿Por qué no están todas asignadas? No todos los municipios todavía participan del sistema, ¿verdad? Así que nuestro fin es que en Puerto Rico total tengamos más de un 90% de los casos investigados para poder realizar esa colección de datos. Uno, educar, obviamente empoderar, pero también realizar esa colección de datos de vuelta para generar políticas públicas dirigidas. Síntomas más comunes, bien acorde con la literatura. Fiebre no es que no está, fiebre está en el 6º lugar, pero tenemos dolor de cabeza, dolores musculares, la pérdida de olfato, fatiga y la tos. Promedios de contactos por persona son 3. Todavía nos queda continuar el trabajo para que las personas identifiquen los contactos y sean parte, ¿verdad?, de poder cortar esas cadenas de transmisión. 8% de los contactos se convierten en casos. Esto es bien importante porque ese 8% ya está en sus casas, y de esta forma podemos disminuir la cantidad de contactos que tienen y por tanto disminuimos la transmisión. En este reporte aumentó un 22% los casos que presentan síntomas, pero casi siempre estaban en un 40%. Todavía hay información limitada de casos que no encontramos porque no se tiene su información de residencia o su número de teléfono. Así que por esa razón se le pide a la ciudadanía que se comunique con los sistemas de rastreo municipal de su municipio y se identifique para que sea parte, ¿verdad?, de esa respuesta. Dirigiéndonos a lo que son estrategias de salud pública. Esto es bien importante enfatizarlo. Nosotros en este último informe incluimos dónde estuvieron nuestros casos positivos 14 días antes de su diagnóstico. Esto no necesariamente son los escenarios después, el escenario donde se infectó. ¿Por qué? Debido a la movilidad. Tenemos un porcentaje de casos altos que tiene más de 5 exposiciones en menos de 14 días. Y es bien difícil uno determinar en este marco de transmisión comunitaria que tenemos, uno determinar en qué lugar se infectó. Sin embargo, la mayoría, pues obviamente estaban en sus lugares de trabajo. ¿Qué lugares de trabajo? Empresas privadas, lugares cerrados, por lo general, hospitales, agencias de gobierno, restaurantes, tiendas al detalle, policías, muchos policías que hemos encontrado afectados, clínicas, centros educativos, supermercados y farmacias. Estos son lugares donde hay que promover las medidas de prevención, pero más allá de promover estas empresas privadas, hay que desarrollar políticas públicas para darle el apoyo a los empleados cuando no vayan a trabajar. Quizás en el gobierno, empleados públicos, se le paga ese tiempo. En la empresa privada no es igual, no necesariamente es igual. Así que definitivamente nos queda mucho por trabajar para que estas personas, cuando le digamos tienes que estar 10 días, tienes que estar 14 días, ellos tengan de qué vivir, ¿verdad? Y no se vean afectados por otra parte, salud mental, que lo hemos visto muchísimo. Así que es importante dirigirnos en esta etapa. Otros escenarios expuestos, reuniones familiares, aquí va mucho la educación y más que educar sobre las medidas de prevención, educar sobre la importancia de planificar. ¿Cuántos familiares se pueden tener en una fiesta? 5, 6 máximo. ¿Cómo vamos a asegurar esas medidas de prevención ahí mismo? Nos queda a nosotros, ¿verdad?, la comunidad científica, poder realizar pues todas estas intervenciones educativas al gobierno también para que podamos proveer esos recursos a las familias para la planificación. 7% asociados a viajes. Bien importante, no lo mencioné cuando vimos la curva epidemiológica, ¿verdad? Estamos entrando a lo que es otoño, ya estamos en otoño, Navidad, y estábamos nosotros viendo si el virus se iba a comportar por temporada y si vamos a ver alza en casos. Estamos viendo el alza en casos, ¿verdad? Y a mí me dicen, Puerto Rico no tiene Navidades. Puerto Rico no necesariamente se refleja el clima drásticamente. Sí, las temperaturas bajan un poco, pero en otros lugares del mundo sí las tenemos. Y un aumento en el mundo, ya lo hemos visto, la pandemia llegó aquí, aumento en casos en el mundo, aumento en casos en Puerto Rico, aumento de casos en Estados Unidos, aumento de casos en Puerto Rico. Nosotros no podemos cerrar el aeropuerto por nuestra situación, así que definitivamente es algo que preocupa y que siempre tenemos que tener vigilantes esos viajeros. Eventos comunitarios, escuelas, cuidados de niños, universidades. En este momento estamos en un porcentaje bajo porque, claro está, las escuelas todavía no están abiertas, así que necesitamos tener un sistema bastante fuerte para cuando abramos entonces las escuelas, no se nos convierta en uno de los lugares más propensos, ¿verdad?, a estos brotes. Por otro lado, fíjense, esta gráfica que les estoy presentando son los días que tarda en entrevista desde el primer día de síntomas. 40 días inaceptables. La mayoría de los casos están en esos 10 días, en ese periodo de 0 a 20 días, la mayoría de los casos, pero no debe ser así. Nosotros debemos estar investigando esos casos en al menos 2 días, un día, desde el comienzo de los síntomas. ¿Y a qué se debe mucho esto? Ahora mismo en Puerto Rico tenemos muchos laboratorios, la capacidad está saturada para procesar las pruebas, citas de 2, 3 semanas. Ayer tuve una situación, una persona tenía síntomas, llamo al laboratorio y me dan una cita para semana y media. Hay mucho que hacer, definitivamente hay mucho que hacer y hay mucho que buscar esa distribución de recursos, dónde es que están para que podamos tener respuestas más rápidas. 1, es hacerle la prueba a la persona en menos de 24 horas que comiencen síntomas. 2, reportarlos inmediatamente. Y 3, comenzar esa investigación. Si yo no tengo pruebas al momento de que la persona tiene síntomas y no tenemos la capacidad de poder reportar esos casos en menos de 24 horas, podemos tener 2,000 rastreadores, entrevistadores, y la respuesta no va a funcionar. Esa es la base. Tenemos que fortalecer esa base y esa es una de las limitaciones que quería traerle. Todavía hay mucho que hacer en esta área. Los brotes a nivel de Puerto Rico, importantes. Nota, lo puse aquí bien grande, la mayoría de los casos investigados no están asociados a brotes. Así que estos brotes que nosotros mostramos en total son 285. Aquí tengo 283, pero es porque tengo 2 que son entre regiones. Dentro de lo que son los brotes, pues tenemos, claro, el escenario familiar, al igual que también las exposiciones que la habíamos visto por casos, que las familiares eran de las mayores. Pues tenemos estos casos, pues que definitivamente nos creamos confianza cuando estamos con las familias y perdemos ese sentido de responsabilidad, ese sentido de mantener esas medidas de protección al día. También en el ambiente laboral, ambiente cerrado. Al principio no necesariamente teníamos esta información, las personas quizás se quitaban las mascarillas en sus lugares de trabajo porque tenían escritorios más de 6 pies, pero en este momento ya tenemos los recursos gracias a la ciencia, ya conocemos, ¿verdad? Que pues puede estar circulando por bastante tiempo, así que definitivamente los lugares de trabajo hay que continuar reforzando esas medidas de prevención y aquí también vuelvo y recalco las políticas para que las personas no tengan miedo en decir que son positivos o decir que son un contacto por faltar a sus trabajos y perder su empleo o perder sus ingresos. En Puerto Rico, la cantidad de pruebas moleculares que se han hecho por día ha ido aumentando, claro. Luego de julio tuvimos esa escasez de recursos y se mantuvo igual. Esta capacidad tenemos que continuar aumentándola. No podemos seguir igual porque, como hemos visto, el sistema está bastante saturado y casos que tienen síntomas no están recibiendo, no se les está haciendo esa prueba en 24 horas. Se han hecho más de 1.5 millones de pruebas en total a nivel de Puerto Rico. Ahora entran las pruebas de antígeno. Ahora mismo está corriendo lo que es un ejercicio de la iniciativa que va a ser Coviveo, que son pruebas de antígeno que vamos a estar utilizando para screening. Hay otras pruebas de antígeno que van a ser, claro, dirigidas a lo que son los pacientes sintomáticos y lo que son las investigaciones de casos, pero tenemos otra estrategia que va a ser para screening a nivel de Puerto Rico para mejorar la cobertura que hemos tenido en los municipios. La distribución va a ser en base a la cobertura que la podemos ver aquí. para poder tratar de mantener esa vigilancia activa en nuestras comunidades. El atraso en días ha mejorado muchísimo desde julio. Julio se tardaban 16 días en promedio, estos son promedios, los laboratorios en reportar, luego en agosto 8 días, en septiembre 4 días. Y algo bien interesante, el sistema municipal en este último reporte, 380 personas llamaron a los sistemas municipales antes de que el laboratorio hubiese reportado su caso, y estas personas se entrevistaron desde antes. Así que es bien importante que la comunidad sea parte de la respuesta y también nos llame. Estas 380 personas, les agradezco muchísimo lo que hicieron, porque si no, de otra forma íbamos a tener que esperar, ¿verdad?, por esos resultados del laboratorio, y quizás cuando comenzáramos iba a ser muy tarde. Próximos pasos, rastreo de contactos digital, y esto es por aplicación. Aquí el Fideicomiso de Salud Pública está en colaboración con el Departamento de Salud para realizar esto. Crear conciencia de lo que son esas conductas riesgosas, la cantidad de contactos que tenemos en un día, eso es bien importante, y esto también se puede hacer a través de aplicaciones. Expandir la distribución, esto es lo más clave que necesitamos ahora mismo, expandir la distribución de los lugares donde se hacen las pruebas y la capacidad que tenemos, tanto molecular como de antígenos. Monitorear los comercios, monitorear las órdenes ejecutivas, las decisiones que se toman, aumentar ese monitoreo y esa fiscalización. Continuar actualizando los instrumentos de colección de datos para guiar las estrategias de salud pública. Cuando comenzamos, no todos los escenarios que se presentaban como de exposición estaban ajustados a la realidad de Puerto Rico. Era un instrumento del CDC que es bastante generalizado, y nosotros hemos ido poco a poco actualizándolo para poder proveer datos que sí guíen esas decisiones en salud pública que estamos tomando. Por otro lado, hacer las colaboraciones con las universidades, las distintas universidades en Puerto Rico, tanto públicas como privadas, son muy importantes. Los estudios científicos y los estudios de salud pública. Ahora mismo tenemos 2 universidades que estarán trabajando en conjunto con el Departamento de Salud para que en los próximos meses, no, ya ahora en noviembre, comencemos lo que es hacer esos estudios de cero prevalencia y prevalencia. Aquí quería traerles un resumen de lo que son las funciones esenciales de la salud pública y cómo, ¿verdad?, deberíamos trabajar esta respuesta. Ese surveillance, esa vigilancia que tenemos en las comunidades, tenemos que mejorarlo. Yo vengo ahora del campo, ¿verdad?, de la epidemiología molecular, hacer esa secuenciación. Si la próxima pandemia comienza en Puerto Rico, tenemos que ser capaces de identificar nuevos patógenos, tenemos que ser capaces de identificar cosas que no son comunes y que están ocurriendo. La preparación, protección, promoción, la investigación. Aquí están ustedes, los científicos. La investigación es muy importante. Es la base para que nosotros podamos desarrollar también las políticas públicas y establecer las guías de epidemiología. Comunicación, empoderar a todas esas personas, la fuerza laboral y finalmente el gobierno. Dije gobierno, no Departamento de Salud. Cuando uno está haciendo una respuesta de salud pública, es el Departamento de Salud, es Hacienda, es el Departamento de Seguridad Pública, es el Departamento de Educación. Somos todos, porque todos nos vemos afectados con esta pandemia. Así que es bien importante tener una sincronía y trabajar integrados para que tanto las órdenes ejecutivas como la política y la respuesta que se esté llevando, pues lleve una sola respuesta. De la comunidad, continuar utilizando la mascarilla, mantener esa distancia, lavado de manos, educar. Nosotros estamos aquí educando, pero ustedes también pueden educar a sus familiares. Identificarse si son casos positivos e identificar a sus contactos y promover las medidas de prevención, promover los lugares que sí practican las medidas de prevención. Finalmente, nos falta mucho por hacer, pero hay esperanza. Agradezco muchísimo a todos los equipos municipales esta respuesta que ha crecido tanto en los municipios como el equipo de nivel central que los está dirigiendo. Son un grupo de jóvenes increíbles que está dejándolo todo y está trabajando día y noche, 24 horas. El Departamento de Salud continúa fortaleciendo su respuesta de una forma increíble. Las distintas ramas que se están creando cada cosa que hacen, cada día trabajamos más en colaboración, ¿verdad? Y pues las distintas organizaciones. Agradezco a la AAAS por permitirme, ¿verdad?, presentar acá a ustedes hoy todo lo que ha ocurrido y cómo es que llevamos esta respuesta en Puerto Rico. Gracias.
Muchas gracias, Fabiola, por esa presentación. Muy agradecido de tu participación aquí en AAAS. A través de nuestras redes sociales tenemos varias preguntas, ¿verdad? De las cuales obviamente no tenemos el tiempo para contestarlas todas, pero sí que hay algunas preguntas sobre el manejo de la enfermedad en los centros de trabajo, que nos den una vez más las recomendaciones sobre cómo se puede asistir al centro de trabajo de la manera más segura. Que nos recuerdes, por favor, cómo es la manera.
Ok, bien importante. Cuando llegamos a nuestro lugar de trabajo, pues obviamente tenemos que tener los dispensadores de hand sanitizer, tenemos que lavarnos las manos. Si usted llegó a su lugar de trabajo, y yo lo digo en mis publicaciones, si llegó a su lugar de trabajo y usted se lavó las manos, usted salvó una vida. Mantener esa mascarilla todo el tiempo. No es que los escritorios están distantes, no, es todo el tiempo que tenemos que mantener esa mascarilla. Si tenemos que descansar de la mascarilla, vamos afuera a un lugar abierto, nos quitamos la mascarilla, pero que no haya nadie cerca, ¿verdad? Y luego entonces continuamos con nuestra jornada. Los lugares de almuerzo. Esto ha sido uno de los mayores señalamientos que hemos tenido. Todos estamos bien cuando trabajamos, pero entonces después al mediodía nos vamos en un cuartito a almorzar todos juntos y ahí nos quitamos la mascarilla. Así que definitivamente esto no se debe promover. Tenemos que almorzar afuera o coger turno para que no haya personas dentro del salón cuando estemos comiendo. Vigilancia de síntomas. Si alguien tiene un síntoma, el mejor momento para aislarse es el primer día de síntomas. No cuando la prueba dice que eres positivo. Cuando la prueba dice que eres positivo ya está tarde. Por eso yo digo, los sintomáticos tienen una ventaja porque podemos darle la capacidad, podemos ser nosotros héroes de la pandemia. Si tenemos síntomas el primer día, nos aislamos, le dejamos saber a nuestro patrono para que patrono asimismo notifique al Departamento de Salud y se pueda hacer esa orientación y esa investigación.
Bueno, muchas gracias, Fabiola. Yo tengo muchas preguntas para hacerte, pero no nos va a dar el tiempo, lamentablemente, porque tenemos un panel y algunos panelistas están bien cortos de tiempo, pero te agradecemos enormemente que te hayas sacado el tiempo de este sábado para estar con nosotros. Siempre es un placer verte y ya te preguntaré tanto las preguntas mías como las que nos han llegado por las redes, así que ya nos veremos. Muchas gracias nuevamente.
Gracias a ustedes por la invitación.
Chévere.
Fabiola, por favor, sigue con nosotros para que participes del panel de la tarde.
Claro que sí, aquí estoy.
Bueno, y ahora tenemos la próxima actividad, luego de esta charla tan tremenda y tan educativa, tenemos un panel titulado A View on the Puerto Rico Response to Epidemics and the COVID-19 Pandemic. En este panel lo va a estar, yo lo voy a dejar con el doctor Carlos Torres Ramos del Departamento de Fisiología del Recinto de Ciencias Médicas, que nos va a dar una breve introducción de los ponentes del panel para comenzar.
Thank you, Abel. Good afternoon. Buenas tardes. It's for me a great pleasure to be here and share with you all the knowledge and the new ideas that all the people have been communicating with us during this conference. I'm really honored to be moderating this session, which is composed of 4 excellent women that excel in the field in science and that inspire us to really do our job, taking in consideration all the highest level of enthusiasm and diligence. So I'm going to briefly introduce each of the speakers. They will have approximately 11 minutes to have their slides. I will let them know about 1 minute before the timeline, so they can wrap up, and also we will have about 30 minutes for questions. So don't worry if you feel a little bit pressed by time. I think we'll have plenty of time to to expand your ideas during the QA session. So first we'll have Dr. Yarimar Bonilla. Dr. Bonilla, she is a professor in the Department of Africana, Puerto Rican, and Latino Studies at Hunter College, and in the PhD program in anthropology at the Graduate Center of the City University of New York. She's a monthly columnist in the Puerto Rico newspaper El Nuevo Dia and a regular contributor to publications such as the Washington Post, The Nation, and the New Yorker. We will then have Dr. Carmen Zorrilla. Dr. Carmen Zorrilla is the acting research dean of the Medical Sciences Campus and professor at the Department of Obstetrics and Gynecology at the School of Medicine. She established the first clinic for women with HIV and participated in the first scientific study to reduce mother-to-infant transmission of HIV. Then we will have Dr. Mariangeli Ortiz. She is the Associate Director of the Puerto Rico Vector Control Unit of the Puerto Rico Science, Technology, and Research Trust. She has overseen the implementation of programs, activity, and strategies, including the establishment of a modern entomology laboratory, a new mosquito surveillance system, the launch of 4 media educational campaigns, community outreach activities, and vector control efforts. We also are honored to have Dr. Marian Bullock Dukas. She is the sub-region, she's the advisor for the Health Emergency Caribbean sub-region in the Pan American Health Organization and the World Health Organization. She has extensive training and multi-country experience in health emergency and disaster risk management, including directing 17 deployments of medical and health teams for the Haiti earthquake in 2010. She served as medical chief officer of Jamaica and technical advisor to the government of Jamaica on all medical and health matters, resulting in successful guidance for the health sector's assessment and preparedness for Ebola and the containment of the chikungunya and Zika virus outbreaks. So without any further ado, then we'll have the first panelist, Dr. Yarimar Bonilla. Welcome.
Thank you. Let me just, I do have a couple of images, so let me share my screen. Okay, so those of you who know me know that I love Bad Bunny and that I'm Yarimar Bonilla. I like to call myself Bad Bunny as well. So first of all, thank you so much for the invitation and for, especially to the organizers for really encouraging me to present, because I was a little bit intimidated about presenting to a group of scientists, o como decimos de la ciencia dura, as a social scientist. But I think also, especially during the pandemic, it's been really hard for me in a way to find my footing, to think about what is it that I can contribute in this moment as a social scientist, and particularly as a political anthropologist. After Hurricane Maria in Puerto Rico, I became very active in thinking about the problems of recovery in Puerto Rico. And, it was not that difficult to figure out how to contribute to the conversation on disasters. For anthropologists, there are well-established roles of what we play in a disaster, particularly denaturalizing a disaster, pointing to the social conditions that turn a natural hazard or an emergency into a disaster, and also questioning, when do disasters begin and end, what are their true roots, and what constitutes recovery, and how can we help define that through through the experiences of individuals. But I don't think there's been a real field developed yet of the anthropology of pandemics. And I think especially for me as a cultural anthropologist, as a social anthropologist, a lot of what I do is to interview people and do ethnography. And so it's been really disconcerting when people are contagious, people are the site of risk. How do I carry out my work? So this has been a very unsettling time for me, and I'm still figuring out what I can contribute. But one thing that I'm trying to think about is first this idea of the pandemic deja vu, of how when the pandemic, this unprecedented global historic event arrives in Puerto Rico, it actually arrives with a large feeling of familiarity. In a lot of ways, people had the social tools with which to get their head around this. And, you know, I like to show this image of Benito, of Bad Bunny at the 2019 protest, wearing a mask and what, like a kind of face shield, you know, long before the pandemic arrived. So there was, you know, in Puerto Rico, we were in some ways, you know, in the vanguard of the pandemic. Another image that I like to show is this one about, you know, I use a lot of memes and I like to analyze memes for what they suggest. So this meme of Puerto Rico, 3 years of history, an illustrated guide. And so it has these 3 objects. The first one being a gasoline container, which was what a lot of people used during Hurricane Maria when they didn't have electricity to fill their generators, either to power their home or to cool their medications, etc. The second one is a backpack, because in Puerto Rico, we began right before the pandemic, we began the year with an earthquake swarm. And so we were all called upon to have these emergency backpacks at the ready. And some of us might have already like forgotten this, or it might feel like a long time ago. But, you know, our biggest problem in January was not the pandemic, but the earthquakes. And we were all already very frazzled. You know, having to sleep with our running shoes on, or the backpacks by the door. And then the surgical mask, you know, arrives as a kind of logical next step in what is the latest disaster in Puerto Rico. So part of what I've been trying to think about is, first of all, what are the long-term effects of these repeated and compounding disasters? But also, what does it mean that we are constantly being called upon to be resilient? And I do want to question this idea of resilience and denaturalize it a bit, because there is a kind of inherent sense that it's a positive thing, but I do think we need to push back on that. And, you know, one thing that I think, especially people in the health field, that I know a lot of you are, you know, questions that I have is, what are going to be the long-term health effects of these compounded disasters? I mean, there's this idea of the Katrina brain, that people, after suffering the stress of Katrina, New Orleans, they had long-term cognitive effects. What will be the pandemic brain, and what will be, you know, in Puerto Rico, where it's not just the pandemic or not just Maria, but also the earthquakes, the state abandonment, colonialism, you know, these kinds of repeated traumas. And so I want to, even as I admire and I'm very proud of Puerto Ricans for how they've dealt with the pandemic, we have to push back and not romanticize that. You know, this other meme that I really enjoy of how Hurricane Maria, the pandemic, the earthquakes, they're all these like different Netflix seasons of Puerto Rico se levanta, Puerto Rico rises up. And one of those seasons is the political uprising of 2019. But again, you know, we have to think carefully about what these mean. And so in terms of the pandemic, one thing that I want to point to is how in Puerto Rico, we have become a kind of risk society. This is a concept developed by the sociologist Ulrich Beck. And one another concept that he develops in relationship to that is how in the risk society, there emerges this idea of organized irresponsibility, where the government, we become used to the government not attending to our needs, not caring for us, absolving itself of responsibility for tending to these disasters. And I have here an image of the infamous chat that was leaked with that, led to a lack of confidence in our governor and to his ousting. And then these almacenes of supplies that were discovered that led people to feel that they were not being protected, in the wake of the earthquakes. And I think that it's really important to keep that in mind as we think about, and I really enjoyed Fabiola's presentation and found it so important to see, where are people getting exposed, what are the risky behavior that they're engaging in, but we have to keep in mind, what do we trust in Puerto Rico? And so to what extent all this organized irresponsibility has led to people really taking care of themselves because they don't trust that they can go to a hospital and get, the attention that they need because they weren't able to do that during Hurricane Maria. So I think when the governor here initially imposed, the strictest lockdown in any U.S. territory right away, people, they didn't protest. We didn't see what people have seen, like in the Michigan Capitol, of armed protesters demanding their freedom and their rights from protection from a pandemic. People here acataron, the mandates of the government. And I think it's partly not because of faith in the government, but because of distrust in the government. And so what we've been able to rely on from Maria, from the earthquakes, et cetera, has been family and friends and community. And so to a certain extent, it makes sense that those are the spaces where we feel safe and where we take off our mask. So while we're in the public area, when we have to deal with the government, we protect ourselves from the government. But it's been really hard for us to then distrust and have fear and feel that we need to protect ourselves from our families and our communities, which is what have saved us in the various pandemics. So, I want to keep that in mind, but I also, and I know I just have like 2 minutes left, I think. So I want to just quickly think about how can we question the narratives of resilience? Because something that really concerns me is the idea of resilience and of being able to bounce back from disaster and after disaster, pandemic, state failure, complete total implosion, lack of basic infrastructure, lack of healthcare. To celebrate our ability to deal with all that is to celebrate that we've become habituated to structural violence, and I've seen the governor of Puerto Rico sell Puerto Rico as an investment site, saying, oh, come look, our population is so resilient, come abuse them, come pay them no money and have no, environmental protections, health protections, etc. So we really need to question that. The second thing is that, the call to flatten the curve, it's a lot of the burden for that is placed on individuals. And I think that that's necessary, but we also think about how to raise the bar, how to demand more from our government, and Fabiola has been doing this amazing work, but it's important to recognize that it was not the central government that brought her here. It was the municipality. The central government has had so many missteps and misinformation, and we really need to hold them accountable and not, the work that the municipalities and communities have been doing is what continues to keep us afloat, but we have to make sure how to do that in a way that doesn't let the central government off the hook. And so that would be my last suggestion, is that, there's this emphasis on surveillance, on contact tracing, and obviously that's really important, but it can't just be surveillance of individuals. We also have to surveil the state, what's happening with testing, what's happening with getting the results and with ensuring protection, and also the private sector. And from Fabiola's slides, we could see that a great number of people who are getting infected or are being exposed, they're being exposed in their workplaces. And, the government implemented this auto certificación, where the private sector, they would just, certify themselves. And then we don't really know, are they providing masks? Are they social distancing? Are they, allowing people to work from home as much as they can? So I think that we have to not just, contact trace and focus on individuals, but also surveil and monitor the other sectors of society that are putting us at risk. So thank you for letting me participate. I'm very happy to be here.
Thank you, Dr. Bonilla. Excellent timing also. We will now have Dr. Carmen Zorrilla. Please join us.
Hello, hi everybody. Let me just find my there
There you go.
Is it? Can you see it?
The presentation, no. Yes, you.
Hold it. Let me just. Can you see it now? No. Hold it.
Do you want me to show it and you say next and I?
Let me see, because I have it. Share. Okay, hold it. Now.
Okay, it's coming up.
Perfect.
All right.
There we go. Oops. Okay. So thanks for this invitation and for allowing me to be part of this conversation. I'm gonna take my time to talk a little bit about what we did with HIV just briefly, and then the response to COVID and some clarifying information regarding this rule of the 10 days without symptoms, so that people don't need tests. And I will explain the data for that, so that people can understand that you might have a positive test, but you're not infectious. And so that's also important. I'll start with a quote from one of my favorite authors, Paulo Coelho, and actually he said that the recompense for our work is not what we win or earn, but what we become from it. So, and briefly, the elimination of perinatal transmission, mother-to-infant transmission in Puerto Rico. This is a graph that from the 90s, the percentage of infants that were born positive from women living with HIV from our clinic, which is the blue graph, the blue line, and from Puerto Rico. The last baby that we had positive born from one of our patients was born in 2002. And before that, we had been for a few years without a single infant with HIV, as well as Puerto Rico. This is where antiretroviral, more potent agents were starting to be used, and this is how the curve really started coming down. So what I just want you to notice that probably from the late 90s, transmission of HIV has been controlled. So let me mention that the WHO in 2015 said that Cuba was the first country in the world who had eliminated the transmission from mother to infant. And based on data from 2012 to 2015. The marker or the indicator for WHO to say that a country has eliminated mother-to-infant transmission is if you have an incidence rate of less than 50 per 100,000. So as you can obviously see from this graph, Puerto Rico eliminated mother-to-infant transmission in 1996. And Cuba was declared in 2015. So this is part of a publication that we're still waiting for it to be out. But this is the clear data that we started a program that it was not just a single person, but a public health strategy that was successful. COVID, I think Fabiola mentioned the number of cases in Puerto Rico diagnosed by molecular versus antibody testing, and the number of cases and death in the United States. And certainly I cannot accept that we have more than 200,000 deaths in the US, because this was preventable, and it is preventable. And so from the scientific point of view, this is something that we could have, if you had listened to science, we would be in a better situation. In terms of the responses by the University of Puerto Rico scientists to the COVID pandemic in terms of quick proposals for research, I'm going to mention just the names of 10 proposals that were funded by the university. 8 of them are from the medical sciences campus, and 2 of them are actually 3 of them are 2 from Rio Piedras and 1 from Mayagüez. But these are the titles of the presentations: of genetic susceptibility to COVID and pandemic-associated stressors, Puerto Rico COVID automated surveillance and health promotion, understanding the thrombotic nature of SARS-CoV-2. Let me move this so that I can read. Immunological characterization of the immune response to COVID, identification and evaluation of SARS-CoV-2 cell entry inhibitors, long-term cognitive and psychological outcomes, and move this again. SARS-CoV-2 genomic epidemiology, host factors associated to the COVID-19 disease severity, marine algae, natural products as antiviral agents for SARS-CoV-2, fighting COVID-19, assessment of the impact of agricultural extension training in the meat supply chain in Puerto Rico. So these are the 10 projects that were recently funded and are probably starting right now. This is our own scientific brainstorming in terms of what to learn from the epidemic locally. We also have NIH-sponsored studies that include early treatment. This is a study called ACTIVE, and this is one of the ads. A breakthrough waiting to happen. This is a person with diagnosis of COVID, and we will have vaccine studies very soon. This is the email for this study. People who have been diagnosed with COVID can send a note to this email, and they might get information on whether they can participate in this particular study. So I want to now go through this issue because I think it represents some of the concerns that people have in terms of why do we need testing, and they come for our testing program insisting that they need to have a test because their employer requires a negative molecular test once they had a positive test. So this is why the CDC recommends it's okay to go back to work after 10 days without symptoms after your first day of symptoms if you had a molecular test. First of all, the concentration of RNA in the upper respiratory tract secretions starts going down after the symptoms appear. So these are all the references. So you have less virus load in the upper respiratory tract after you have symptoms. In addition to that, whatever virus you have in that upper respiratory tract is non-replicating virus. So most of the people who have virus, and you can identify by molecular testing, this is non-replicating virus, therefore it cannot infect, it cannot be transmitted. And even though in some populations with immune suppression and severe COVID, they have identified replicating virus between 10 and 20 days. This is a very specific group of people with immune suppression and severe COVID. And then additionally, there was a study of contact tracing on people who had been diagnosed, and both close contacts like family contacts and hospital contacts they didn't have transmission if their exposure was after 6 days after the patient started with symptoms. So after you start symptoms, you start decreasing your virus load in your upper respiratory tract, and people who are near you, there's no evidence that they were infected if they were exposed after those 6 days. So if you start adding the numbers, that's why you get the 10 days. And again, after 3 weeks, there's no replicating virus in people who are positive, but still you have people who can be positive even for 12 weeks. And so this is the issue, and I just want to mention that in the laboratory that is working at the Medical Sciences campus, one of the tests says that sensitivity is about 12 copies of the virus, but they started diluting and diluting and diluting, and they were able to identify up to 1 copy of the virus. But that means you can identify the virus, but that virus is not replicating, you're not contagious. So one thing is to have a positive test, another thing is for you to be infectious or that you can transmit the infection. So right now we don't have a quantitative, and people are trying to modify the interpretation of a test that's qualitative. That means that it's positive or negative, and to try to tell whether the virus load is high or low. But this is something that we need to leave science and scientists to make sure that we have the data that we need. So finally, I'm going to talk a little bit about vaccines. So perfect people don't drink, don't fight, don't lie, and don't make mistakes, and they don't exist. And so for all of us who are not perfect, we might need that vaccine. And so very briefly, the Operation Warp Speed, just to make sure that you understand, warp speed is an invented term from Star Trek. This is from science fiction. There's no warp speed at all in science, but this is a term that we got from Star Trek, and it sounded fancy and science fiction, so they used it. What it means is that the NIH and several institutions in the US decided to get 14 candidates of vaccines that out of the 100 that were closer to development. From those 14, they went down to 9. And of those 9, they are going to do phase 1, 2, and 3. That means all the studies that you require to develop a vaccine, first from having the vaccine and find out which is the dose that people will find it safe and that will acquire levels in blood. Then phase 2 is a little bit larger group where you want to know whether the vaccine is safe relatively and how people react to the vaccine. And then the phase 3 usually takes 30,000 volunteers on whom you might have two people with vaccine and 1 person with placebo, because you have to compare if the vaccine is safe and if the vaccine works. So even if we have the warp speed, we cannot accelerate the phase 1, 2, and 3 programs. That is the standard length. What we do to accelerate is that while the phase 2 and 3 are being done, government gave millions of dollars to companies for them to start producing the vaccines. If the study, at the end of the study, they find the vaccine which is safe and effective, then they have had the vaccine produced and we could be using it. But that's sort of like a risk. If the vaccine doesn't work, you made a lot of doses that you're not going to use. And one of the community members told me once, yes, it's warp speed, but it's at the speed of the community trust. You cannot accelerate even science if you don't have the community trust. So this is very important for people to understand. This is how we're going to be doing this. Science is not going to be compromised by politics. So these are the types of vaccines: DNA, RNA, and proteins based on the virus spike. We have platforms that mean where do you put these things? Either on a viral vector, that's like an adenovirus virus, or a different kind of virus that's either non-replicating, that means that the virus is there and that's it, or the virus is replicating and multiplying in your body but not causing disease, but it's just transmitting. It's the car that brings the passenger to your body. And of course,
so Rita, the time is up. So
okay. Finally, the biopharma leaders united to stand with science. That means that no vaccine will be produced or implemented without the appropriate data. Thank you so much.
thank you, Dr. Zorrilla. We will now have we'll have questions. We'll have a half an hour of Q&A after the last presentation. So now we'll have Dr. Ortiz. Evangeline.
Hello, everybody. Thank you for the invitation. I'm here. I'm gonna share my slides. Okay. I'm gonna be speaking in Spanish since I think most of our audience is Spanish speaking, but please feel free to ask any questions during the panel in English. So I'm switch to Spanish now. Hola a todos, gracias por la invitación. Yo voy a estar hablando un poquito de otro tipo de epidemia, no enfocada en el COVID-19. Me voy a ir un poquito al pasado, cuando tuvimos, ¿verdad?, epidemias, a la epidemia de Zika. Pero quiero entonces hablarle del trabajo, ¿verdad?, que estamos haciendo y de cómo el trabajo comunitario es el factor, ¿verdad?, más importante e integral durante una epidemia. Para asegurarme que todos estamos en la misma página, ¿verdad?, soy de la Unidad de Control de Vectores de Puerto Rico, así que ¿qué es un vector? Y es básicamente un agente capaz de transmitir un agente infeccioso, un patógeno. La mayoría son insectos, aquí pueden ver algunos ejemplos de esos insectos, pero el más peligroso es el mosquito. De hecho se conoce como el animal más peligroso del mundo, porque causa alrededor de más de 700,000 muertes al año, y aunque hay más de 3,000 especies de mosquitos, no todos ellos son vectores, y el que nos preocupa más en Puerto Rico es el Aedes aegypti, que es un problema en el mundo. Causa dengue, zika, chikungunya y la fiebre amarilla. Y de hecho, en el 2019 fue un año récord para dengue en América Latina y el Caribe, con más de 4.2 millones de casos globalmente. La mayoría de ellos fueron en América Latina. En Puerto Rico no tuvimos esa situación. Todavía no se sabe muy bien por qué. Creemos que hay protección cruzada porque nuestra epidemia de Zika fue bastante significativa, pero es una de esas preguntas que tenemos, aunque los casos ahora mismo están en aumento. Y esta es una gráfica que muestra las epidemias que hemos tenido en los últimos años. El dengue es endémico en Puerto Rico. Tenemos epidemias cada 3 a 5 años, ¿verdad? Menos reciente, la última que tuvimos fue en el 2013, así que va un poquito más de tiempo, y ahora que los casos están aumentando, no lo tengo aquí porque aquí está hasta el 2017. Pero tuvimos entonces dengue en el 2010, 2013, luego chikungunya en el 2014, Zika en el 2016. Y quiero hablarles un poquito, creo que los puertorriqueños vamos a recordar muy bien la situación de Zika. Cuando llega Zika no había un programa de control de vectores eficaz por el recorte de fondos, y esto es uno de los problemas principales, ¿verdad? Se van recortando fondos durante esos periodos que no hay epidemias, entonces cuando llega la epidemia, pues no tenemos un programa funcional. Se determinó que había resistencia a insecticidas, así que tras que no había un programa completo, la única solución que teníamos, que era rociar con insecticidas, no estaba siendo eficaz para la Aedes aegypti en particular. Se recomendó utilizar Dibrom o Nalet, como lo conocen comúnmente, y hubo mucha preocupación por los efectos a la salud y al ambiente que podía tener, ¿verdad? Los efectos secundarios. Y una de las cosas que observamos durante ese periodo fue la falta de una comunicación efectiva y de alcance comunitario, ¿verdad? Porque se escuchaba en todos los medios, y yo creo que los diferentes grupos que estaban opuestos a las diferentes alternativas que había, o específicamente al NALED, fueron muy efectivos comunicando, pero entonces no teníamos la parte opuesta, ¿verdad?, de los grupos de control de vectores del gobierno federal y el gobierno local, explicando pues cuáles eran las alternativas que había, porque NALED no era la única alternativa que se estaba considerando en ese momento. Y entonces esa falta de comunicación pues fue muy limitante en lo que se pudo lograr, y al final realmente la respuesta que hubo contra el Zika fue prácticamente nula. Así que eso causa que expertos de diferentes partes del mundo se reúnan y busquen una solución. Así que esa solución, ¿verdad? Creo que la unidad de control de vectores tiene mucho que contribuir, pero parte de lo que hacemos es traer este método integrado, ¿verdad? Somos una organización que surge en un acuerdo entre los CDC y el Fideicomiso para las Ciencias, una organización sin fines de lucro privada, y con este método de Integrated Vector Management, lo que buscamos es, como había hablado, y me hago eco de las palabras de Fabiola, de lo importante que es la colaboración. Esto no es tan solo responsabilidad del gobierno, es de todos, y que todos trabajemos en conjunto. Pero hay que tener datos, o sea que tenemos que tener científicos involucrados, tenemos que tener las agencias del gobierno, los municipios, el sector privado, tenemos que estar abiertos a diferentes alternativas que sean efectivas, integrar diferentes métodos, desarrollar la capacidad que tenemos en Puerto Rico para manejarlo. Como dijo Fabiola, la verdad, estar entrenando a la gente, a los soldados durante la guerra es bien difícil, pues vamos a prepararnos desde antes. Y por eso es que pues, no tengo tiempo de hablar de todo, pero quiero entonces enfocarme en lo que es la movilización comunitaria, que al final siento que es la base de todo. Nosotros tenemos un programa donde básicamente hablamos con los líderes comunitarios, nos reunimos con ellos, son la primera línea que tenemos de comunicación. Luego tenemos campañas en relaciones públicas, donde entonces vamos a todos los medios y al público general. Tenemos diversos programas de educación y entrenamiento, particularmente enfocados en las escuelas, donde participamos desde campamentos de verano, ahora mismo con charlas virtuales, acuerdos con el Departamento de Educación, y ciertamente las colaboraciones que tenemos con todos los diferentes grupos, desde universidades hasta el sector privado, el gobierno y los municipios. Este slide creo que resume todos los esfuerzos que hemos tenido. Como le digo, empezamos con esos contactos directos, y luego tenemos diversas actividades. Hemos impactado, ¿verdad? Miles de estudiantes, tenido presentaciones. Aquí tenemos una presentación en una universidad. Tenemos aquí llevando unos talleres a niños durante los terremotos, visitas casa a casa. Aquí en esta foto le muestro ver las visitas casa a casa que tuvimos en colaboración con el municipio de Bayamón. Hemos traído diversidad de actividades para que sean dinámicas y diferentes, ¿verdad? Y ahí pueden ver virtual reality. Y durante todas estas actividades, pues distribuimos repelentes, larvicidas y material educativo. Tuvimos una campaña que lanzamos a los medios en el 2018, y luego, ¿verdad? Ahora en el 2020, cuando empezamos a ver un aumento en los casos de dengue, la volvimos a lanzar con estrategias bien fuertes de relaciones públicas, donde tuvimos más de 60 entrevistas en alrededor de 2 meses, en radio, televisión, redes sociales, buscando todos los medios y haciendo análisis de cuáles eran los medios que estaban más activos, porque la gente estaba ahora en sus casas, ¿verdad? Así que todo eso tenemos que tomarlo en cuenta. Esta campaña la evaluamos, logramos ver que estaba teniendo un impacto en las personas, y la semana pasada recibí un premio de Excel por la mejor campaña de comunicaciones integradas por todos los diferentes medios que utilizamos para distribuirla. Aquí voy para el siguiente slide que creo que es el portal video, no me quiere pasar. Aquí, perdonen. Tengo entonces las redes sociales. Aprovechamos las redes sociales para trabajar diferentes aspectos, ¿verdad? Incluyendo lo que son los aspectos culturales y lo que está pasando, para que la gente esté engaged, porque tenemos que hablar de los temas que la gente tiene interés, y ¿verdad? Nos unimos con lo que es el coronavirus, para entonces decirle, los mosquitos no transmiten el coronavirus, y la gente así está más atenta y más pendiente a nosotros, además de que estamos haciendo colaboraciones con diferentes grupos, y tenemos diferentes lugares como Facebook comunitarios, por ejemplo, para diseminar nuestro mensaje, y a través de esos Facebook comunitarios impactamos a más de 50,000 personas. Así que, en conclusión, esto es solo un ejemplo de todas las actividades que nosotros trabajamos, ¿verdad? Con las comunidades, y esto nos ha ayudado a lograr el colocar más de 2,000 trampas de vigilancia en todo Puerto Rico, donde tenemos que ir a las casas de las personas, evaluar lo que es la aplicación del herbicida, que fue una de las técnicas. No sé si algunos de ustedes se recuerdan de Vectovac, que hubo mucha confusión porque pensaban que Vectovac era lo mismo que Nalet, ¿verdad? Vuelvo a esa falta de comunicación efectiva. y logramos implementarla y evaluarla en 2 municipios de la isla con resultados fantásticos. Y más recientemente logramos empezar la liberación de millones de mosquitos machos. Pensando nosotros como somos los puertorriqueños, que somos tan efectivos protestando, pensamos que iba a ser bien difícil lograr liberar todos estos mosquitos, pero tuvimos un equipo y una estrategia de comunicaciones y alcance comunitario tan efectiva que hemos logrado, llevamos ya 2 meses liberando mosquitos con mucho éxito. Así que en conclusión, el tener ese manejo efectivo de la comunidad y de esos stakeholders importantes, porque no tan solo es la comunidad, sino también aquí pueden ver que tenemos en una de las fotos una reunión con la alcaldesa, líderes comunitarios, colaboración con restaurantes, toda esa combinación de estrategias nos puede ayudar a lograr que la comunidad acepte su rol y que acepte también las tecnologías que van a ser efectivas. Así que nada, con eso agradezco a todo el equipo de trabajo, especialmente al equipo de comunidad que hizo este trabajo, pero tenemos todo un equipo de campo y de laboratorio que nos apoyan muchísimo. Así que gracias por su atención.
Thank you, Dr. Ortiz. Excellent presentation. Before we move to the last presentation of this panel, I would like to encourage all the people that are watching these presentations to start posting your questions. We'll have a period of about half an hour of a Q&A, and each of the panelists will be answering questions. So please start posting them in the different social media outlets that we have available. Okay, now we'll move now to the last presentation of this panel, and we have Dr. Marion Bullock-Dukas. Dr. Bullock-Dukas, please, you may start.
Thank you very much for inviting PAHO to do this presentation. And I would like to start by taking everyone through what has been PAHO's response to the COVID-19 pandemic, and just looking quickly at an overview of some of the lessons learned and key points. I'm going to be looking at just one slide from the Director General of WHO on the reality, the update on the pandemic, and the PAHO response. So the WHO Director General, and it's the last point I want to focus on, saying that we can continue to save lives and suppress transmission, but countries have to be in control of transmission if they want to open borders or relax public health and social measures. The world is now at 41.8 million confirmed cases, included 1.14 deaths, and those are staggering figures. We know that the region of the Americas continues to lead with 19.3 million cases, that's up to today, followed by Southeast Asia and Europe, both at 8.8 million. This slide just shows what is happening. The bars are the cases, the lines, the death. And the main thing here is to note that Europe has now overtaken the region of the Americas in terms of the upsurge in cases and new cases being seen. And that is also noted in other regions, such as the Eastern Mediterranean. This map shows with the deep brown the countries' cases reported in the last 7 days, and the deeper colors are over 1,000 per 1 million population. So there is still intense transmission in many.
Bullock, your slides are not moving forward. They're stuck in
I'm not sure what's happening. Are they moving now?
Nope.
Oh, they're moving for me.
Yep.
I probably would have to try to screen share again.
Yeah.
Marion, do you want me to show them on your
Yes,
video?
you could share them for me, and I will indicate when you should move forward. Thank you so much.
Sure. Okay, let me share. Just a second.
Okay, so I have gone beyond that. You can move ahead. Right, go ahead. Next, 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 next. Next. Yes, I was saying that here now we are seeing the deeper colors indicating where the majority of cases have been reported in the last 7 days per 1 million population. Next. And this just shows the deaths now reported in the last 7 days per 1 million. And we see in the region of the Americas, we see Mexico and Argentina with large numbers being reported daily. Next. This is showing the transmission type, and the bright orange you're seeing for most of the Americas and the larger countries in the Caribbean would indicate that it is community transmission, more intense than the clusters or the sporadic cases. Next. And for the region of the Americas, I just wanted to focus here. The main point here is that there's an increase in the number of cases reported this week, with new cases now at 130,000 per day in the last week, up from 90,000 in the week before. And the next slide just shows the deaths that have been occurring, and the trend is pretty similar this week. Those spikes to point out is when data has been adjusted and all of the cases that were not reported before added. Next. This focuses now on what is happening in the countries with the largest number of cases, cumulative cases over 10,000. We see here Puerto Rico over 60,000, and persons there would know these figures very well, 791 deaths. And these have been reported to WHO, with the United States of America having the largest amount of cases at 8.3. Mexico, however, has the highest case fatality rate at 10.1%. And in the next slide, you will see that focusing on the Latin Caribbean countries, Puerto Rico is represented in the peach, and cases have increased in trend since the start. And this just points out and is based on the reports that are provided on a daily basis to the Pan American Health Organization. Next. This shows what is happening in Central America and in the Caribbean, and the deeper purple colors, that is where cases, they're the highest incident rates per 100,000 population. And we see again, it's the larger countries that have the largest increases. Next. If I turn quickly to the support that PAHO is giving for the region of the Americas, just to note that PAHO activated its incident management system and support team from the 17th of January, as soon as it was clear and the novel coronavirus had been identified. And in the next slide, you will see a compilation of just what health emergencies is all about. And the work that is being done for COVID-19, of course, is against the background of the 1 billion platform that WHO has been using for the period listed for better protection from health emergencies. And on the left is just an indication of what the program consists of. And this is what is being seen largely in the COVID-19 preparedness and response, looking at from surveillance to ensuring country preparedness and response and emergency operations. Next. This overarching slide points out the critical frameworks that guides the work of PAHO Health Emergencies. You will recognize the Sustainable Development Goals logo, Sendai framework, and the Conference of Parties, Climate Change, and the Sustainable Health Agenda for the Americas on the right. And all countries in the region of the Americas have been using this before COVID-19, and this is underpinning their work now. Next, you will see on the left is a plan of action for disaster risk reduction with 4 strategic lines that guides the work of all countries in the region. And on the right are the 9 pillars that guide the UN WHO COVID-19 Strategic Preparedness and Response Plan. A number of countries have adopted the information in these pillars and are ensuring that they systematically strengthen each. Next. You will see the critical actions for response for PAHO. It's in 4 big blocks: save lives, protecting healthcare workers, and slowing spread, ranging from reorganization of health services and planning workforce surges to detecting and isolating cases, protecting healthcare workers at work and in the community, and looking at surveillance and the laboratory to ensure that these areas are strengthened. Next. This is a compilation of the PAHO response, looking at the 107 technical guidance documents and recommendations that have been shared from this pandemic has started to the 17.8 million PCR tests that have been sent to countries. And there are 32 of the 35 countries which were supported by PAHO to establish COVID-19 PCR testing, also including the Caribbean Public Health Agency. You will see the large numbers of PPs in the millions that have been sent to countries, as well as the readiness, which is ensuring that plans are in place, that's on the bottom line, that the in-place surveillance is used to detect respiratory infections, and also to ensure that countries are strengthening infection prevention and control and water and sanitation and health. Next. Just a quick word on the landscape of candidate vaccines. I don't need to say anything much. It was well explained before, including the numbers and the various phases. You can move on. And only to say that this COVAX facility, in order to ensure equity, WHO and PAHO are working with global partners to ensure that countries that might not be able to afford to put down billions or millions will have access to safe vaccines when they become available. And the PAHO group is working en bloc with all of the countries to secure this through its revolving fund. Next. The matter of expanding diagnostic networks, difficulty with testing in rural areas, etc. This has been strengthened with WHO now approving next. The use of rapid antigen detection tests, which are coming on stream now in the region to allow for more testing at the first level of care, including in primary care. And countries are aware of this. Tests have been ordered and some are being delivered now. Next. Just to remind, the emergency medical teams, formerly called foreign medical teams, are assisting, including national teams, to ensure appropriate critical care for persons who are affected. And the next slide just reminds that our infrastructure needs to be in place. And the PAHO Smart Healthcare Facilities Program, which allows safety of infrastructure and functioning and greening, has continued throughout the pandemic. Next. In summarizing, I just want to look at some of the key lessons learned. We have learned through this pandemic that for sustainable development, the health sector must be an integral part of socioeconomic development plans for countries, territories, and areas, and that the all hazards approach to emergency and disaster risk management for countries enhances appropriate and timely preparedness and agile response measures, including for communicable diseases and pandemics, not just hurricanes and earthquakes, and that the health sector efforts for disaster risk reduction have to continue, guided by the frameworks mentioned, so that there will be resilience and readiness at all levels with appropriate skill sets to achieve universal health access and coverage. Health system strengthening has to continue, and it must include essential public health functions. And the last slide looks at the key points, a summary here. PAHO WHO, of course, will continue to support countries, territories, and areas in their efforts to achieve the Sustainable Development Goals by 2030, control of transmission of SARS-CoV-2, and containment of this pandemic has to include implementation of sound public and international health principles guided by the international health regulations and scientific information on this novel coronavirus. Intensive coordinated actions will need to continue within the health sector and across sectors with strong leadership to maintain the balance between saving lives and livelihoods. And not by any means last or least, mental health and psychosocial support programs must be strengthened to ensure holistic preparedness, response, and recovery for all health. This pandemic of all has shown that we have to remember that health is holistic and that person's mental health has to be respected, nurtured, and improved. Over, and thank you. Next. Thank you.
Thank you very much, Dr. Bullock. We have a couple of questions for you, but we would like to start first with Dr. Bonilla because she has a previous commitment. So please stand by. I have Dr. Baerga, please. You have a question for Dr. Bonilla before she leaves?
Yes, congratulations, Dr. Bonilla. Thank you so much for being with us. I just had a question. You mentioned about the differences or the contrast between the hard sciences and the social sciences. And the truth is AAAS as an organization has a policy where there's representation from the social sciences as well as from the biological and physical sciences. So it's all science as far as AAAS is concerned. However, in the biological sciences, the number of publications with the COVID-19 epidemic has exploded to the point where it is really hard to keep up. I had a question regarding your comments on how it's been in the social sciences. Is there a similar explosion in the number of papers dealing with social aspects and cultural aspects of the COVID-19? How's that been? How's that experience been from an academic in the social sciences and cultural studies?
Yeah, I think there has been a bit of an explosion. The SSRC, Social Sciences Research Council, they've created I think it's called COVID syllabus. I can double check and put it on the chat later, where they've been collecting links, of so many things that are coming out, and also resources to think historically about, pandemics and plagues and stuff like that. But at this, I mean, I can't speak for everyone, but in terms of the social sciences, but I know that for me, it's also been a little bit of a pause. On the one hand, there's been a lot of flourishing, but I think a lot of people, similarly to how I'm sure some scientists don't have access to their labs, etc. So social sciences, we don't have access to our labs because we can't talk to people, or a lot of people are figuring out how to pivot in terms of doing interviews over Zoom or over phone, etc. So I think there's going to be a little bit of a lag in terms of the boom of literature, academic literature about the pandemic. But one colleague that I do recommend that anyone who's interested in thinking more about the pandemic through a social scientific framework is Carlos Caduf. I can put a link on the chat for that as well. He wrote a book called Pandemic Perhaps, about a pandemic that never came. And so he's really great on Twitter. He's been, tweeting a lot and trying to think critically, for example, about the lockdown, to think critically about different, different narratives about the pandemic from a social scientific network perspective. I'm thinking again about, the overburden on individuals, and also, the role of the state. I mentioned a little bit about this in my presentation. Like in Puerto Rico, the governors has said a lot, tienen que poner de su parte, like everyone, individuals have to play their part. Yeah, but what's the part of the state? Like where does the individual part begin and end? And so much of the state measures have been burdening individuals, have been lockdowns, curfews, homeschooling, and I really wonder, like, I keep thinking, this is not my case, but I keep thinking, what's happening with a single mom who's homeschooling, who's working from home, who, you know, or maybe she's been furloughed. You know, how are individuals supposed to manage all of this? And the way, you know, the government programs that have even been implemented have been so hard to access. The unemployment lines were crazy. You know, and this is part of what I was doing as a social scientist. I was trying to do research on this Facebook group that emerged for people who were applying for the PUA, for the you know, unemployment assistance. Like, there's people who just did not receive any income for 3 months, you know, who lost their jobs because so many people in Puerto Rico work in the tourism industry or the food industry, etc. And, you know, what role are they supposed to play? ¿Cuál es su parte? And what is the parte of the government when you have people who have no income, who have to homeschool their kids, who might not have that technology, who don't have appropriate internet or even stable electricity to do so? So I do think that we need to be critical about that. And I do hope that once the social scientific literature catches up, that will be one of the things that we are emphasizing and thinking through. And I'm here if there are any other questions for me before I have to log out.
Yes, I'd like to pose you a question regarding critical thinking. So this lockdown posed on millions and millions of students, middle school, high school, university, working from home, doing a lot of conferences, some with teachers who have, you know, their own personal loads. So how do we envision the future will be like for kids, you know, for the future of our society? How will they envision leadership and how the society will move with them having lived through the pandemic?
Yeah, I mean, I don't think I have the answer yet, but it's certainly a question that we need to be asking. You know, in Puerto Rico, we already had this Generación María, Generación Crisis, but that is also la generación del yo no me dejo. And so I think it's unclear what this generation that is also the generación of the debt and la muerte del ELA, and, you know, el final de las promesas. And so and part of what I write for people outside of Puerto Rico is to say, you know, Puerto Rico is an important place to think about how, in general, as a global society, how are we going to envision our post-disaster future? You know, across the world, we are living in a society where the future is not, it doesn't, the future looks like it's going to be worse than the present, you know, and that was not always the case for our parents. You know, the future was progress, development, advancement. And so for our current generations, the future is climate change, austerity, greater disasters. And so I think we still need to look at this. I don't have the answers, but I think that it's important to focus particularly in Puerto Rico when we've had so many layered disasters, of how young people are thinking about the role of the state, thinking about the future, thinking about their current lives, and about how to protect themselves and how to engage with risk, because we have so many risks that we have to entertain right now. And so I do know also we have to think about a kind of global mental health. My students, I'm teaching long distance at Hunter College, and I know that it's such a struggle for my students to stay motivated, to be able to learn. And these are kids that, you know, the university is giving them laptops and hotspots. And so the technological barriers are not the problem, you know? So imagine, you know, the folks that are dealing with all this emotional baggage and a kind of this feeling of insecurity and uncertainty about the future, and the future being also tomorrow, you know, because you could get contagiado at any point, you know, and on top of that, to be dealing with a digital divide. I mean, I don't want to say this, but I think that a lot of young people are going to give up on school and give up on you know, continuing on these pathways unless we do something, because if their only access right now to education education is on a cell phone, that they might have to drive somewhere to get a connection even from that, which we've seen news articles in El Nuevo Dia about kids, that's the situation. They have to go get into a car and drive somewhere to be able to access their phone school. And there's others who are learning from some photocopied modules that the state, the education department is giving. It's going to be really hard for these kids to stay engaged. So we do have to figure out, how to engage folks. And I do think that particularly in the sciences, like this is a moment where a lot of people could become more interested. I mean, I myself have been reading so much more about epidemiology and how things, I've learned so much that I never had thought about, so it could be a time where there could be a boom of people coming into the sciences and thinking more about global health, public health, etc. But we have to do something to make sure that happens. But I will say, I do think that people like Fabiola, who is like a rock star in my family, we admire her so much. The example of young people like her and others that have shown that how you can serve Puerto Rico through the sciences, and I think everyone at Ciencia Puerto Rico and so many, folks in Puerto Rico, our scientists have become like superheroes right now. And I think that that's been like a really important moment, and a moment when the state has failed us. Individual scientists, Boricua scientists, have really led the way and have become an inspiration. So hats off.
Yeah, thank you. We have a couple of questions to Dr. Volk. In sake of brevity, I'm going to combine some of them. Dr. Bullock, people are asking, how is there a collaboration between PAHO and Puerto Rico, and and now how that collaboration may be affected by President Trump's threats of withdrawal from the WHO, and if that happens, how can we maintain those collaborations?
Okay, thank you for the question. Just to say that PAHO continues to serve all of its member states, associate states, and others who are various types of members of PAHO. To bear in mind that PAHO is a regional office of the Americas for WHO, but PAHO in its own right was actually established in 1902, well before WHO was established, and has its own relationships within the region. And therefore, PAHO has continued to support all of its countries. And as the situation unfolds, we will see. But PAHO, as the Pan American Sanitary Bureau, continues to function and will continue to function in support of all of the countries in the region of the Americas. Over.
Okay, thank you. There is another question regarding the 9 pillars that you mentioned. Which of those pillars have been most successfully implemented in Latin America, and which is the one that is given the most trouble? Dr. Bullock, are you there?
Yes. For the 9 pillars, I'll say that the majority of them are being successfully implemented because they really have built on the current work for emergency and disaster risk management, as well as the areas of disaster risk reduction. So for surveillance, rapid response teams, case management, that built on the current systems that were already in place, and most countries had these which were working well and sharing information across the various networks, points of entry, national labs. You saw the strengthening down there. Infection prevention and control has had to be broadened, because while this focuses more on the healthcare workers who have been trained in this area, a number of other sectors have had to be working on the front line as well and have needed additional training. And so the provision of personal protection equipment for the security forces, not just healthcare workers, others who work even in the transport sector, to ensure that everyone understands how to wear their mask appropriately, the importance of hand washing and sanitization, plus physical distancing. So this one continues to get the focus and to ensure that it is being dealt with. Case management continues, and all countries have been trying to increase their capacity. One of the most difficult pillars has been pillar number 9, maintaining essential health services during an outbreak. Because while countries are focusing on the various measures, including curtailing movements of their populations, some persons have not been able to access their routine services. For example, for the non-communicable diseases, those with diabetes, hypertension, asthma, the cancers. And because of job losses or curtailment in income, some persons find it difficult to even provide for themselves where it's not provided by the state. So countries continue to be encouraged to work across all the pillars, which is mainly their routine work, and they are supported. But now, because of the focus on the pandemic, they have to be encouraged. For example, immunization, childhood immunization, which was a flagship program, and the benefits are well known. That has to be given special focus to ensure that even when persons go out on field visits, contact tracing, that they can also inquire what is happening with the children. Let's see the immunization cards. So maintaining the gains is something that we have to continue to ensure while understanding the difficulty and assisting in providing the support to countries. Over.
Thank you, Dr. Pollock. We have now a question for Dr. Ortiz. The question deals with how your Air Force against dengue, the fact that we are in the middle of a pandemic with the COVID. I guess the question is how easy or how difficult it is to talk about dengue when we are dealing with COVID-19.
Yeah, that's a very good question, and it's definitely a challenge because the attention of the people is on COVID, is what they want to know about, and not only that is that people don't want to hear about another disease. You know, you're dealing with COVID with all the issues that were mentioned before very well by Dr. Yarimar Bonilla, and you know, psychological, social, that living with dengue as well is just an stressor, an additional stressor for people. So the way that we needed to make that decision at some point, and be very careful at what point we needed to start creating the awareness that dengue was there as well. That is happening, that cases are increasing, because you know, the eye is going to be a burden emotionally for people, but we don't want to have two epidemics at the same time in Puerto Rico. We don't want to saturate our hospitals. And so we have tried to make that message possible, trying to look, combining it with, for example, we did a flyer, an educational material about comparing dengue, COVID, and influenza in collaboration with the Public Health Trust. We have making posts or educational activities that talk about why the mosquitoes doesn't transmit coronavirus. So we're trying to integrate the message of dengue within the message of coronavirus. And that has been helpful. And also trying to look for solutions so that if we present to people the situation that we're facing, that we're also alternatives, like the projects that we're doing with the larvicide and the mosquitoes with Wolbachia as positive things that we are doing at the same time. I guess that has been, I don't know if it's working, if it's not perfect, certainly, but it's the way that we have been trying to deliver the message.
Thank you, Dr. Ortiz. We are running out of time, but we still have questions to Dr. Zorrilla and also to Fabiola. So please bear with me. Dr. Zorrilla, people are asking about the possibility of having in Puerto Rico access for the vaccine, and at the same time they're asking, what about clinical trials involving people from Puerto Rico?
Yes, thank you for asking that. That was my last slide. Yes, we're going to have vaccines. There's several vaccine trials that are going to be implemented. I cannot actually disclose the one that we're going to be having, but I can give you an email address where you can find information. It's, let me see if I can find it. It's estudiosvacunascovid.rcm. Let me see if I can find it. rsm@upr.edu. So that will be the best way to get information on our. We are going to start a vaccine study in November. We will be enrolling volunteers from all ages up to from 21 years old, because that's the legal age for consent in Puerto Rico. And most of the studies for vaccines include people with chronic conditions that are stable, including HIV, asthma, diabetes, and they would like to enroll people over 65 years old. So there are at least 3 studies that are going to be implemented in the island, and I'm going to be leading one of them.
Thank you.
Dr. Correa, if you can put that email in the chat, we can certainly put it on our website.
Okay, perfect. I was.
Dr. Zorrilla, I had a follow-up question to that, and it has to do, are the 3 different vaccines that are going to be tested, are they 3 different classes of vaccines?
Yes, I don't have the information on the other 2, and I am concerned that one of them might be a live vector vaccine, but I don't have information that to confirm that. I know that one of them will be the Johnson & Johnson. Another one is AstraZeneca, which is a protein, and another one is going to be a protein. So, but somebody mentioned at some point that somebody was going to study one of these Chinese vaccines. The Chinese vaccines are live vector. So I would be concerned if we have a live vector or attenuated vector vaccine, because that might not be accepted in our community, and there would be concerns, and then people would think that all vaccines are the same. So that's my concern with the live vector vaccines right now.
Thank you. So the last question is for Dr. Fabiola Cruz. The question is about the availability of the data available by the Department of Health in Puerto Rico. What is the easiest, I guess, how can people access that information? Is there an easy way to access it in order to establish strategies regarding public policies?
Yes, and then the Department of Health have their web page where we are posting all the reports weekly. Also, the Department of Health have the portal for here, where you can take from the API all the data. That's where we're from. The institute, the Statistical Instituto de Estadística is taking the data from, and other scientists. I think we must have a easiest way to have the data for the people. However, I think that the APIs can help with that, APIs to the Department of Health page.
Okay, right, thank you very much.
Okay.
Ray, with this, we conclude this section. Thank you for a very interesting interaction. And we're gonna have a break. And then we're coming back for the poster sessions. Please don't go away. Please participate of this section, the next section, which is the poster session. And then we have the Lucy Gaspar Award. So those are very, very important components of this meeting. Abel, do you have anything to add?
Just to remember to follow the activities of AAAS Caribbean Division on the Facebook page. Please look us up in Facebook and follow us. That's AAAS Caribbean Division, AAAS Caribbean Division.
And
Thank you so much.
And also think of ways that AAAS Caribbean Division can help you in your projects. We can certainly share information, and we can create, you know, the science cafes that we normally prepare every 2 or 3 months. So please include us in your plans and how to help you disseminate your messages. Okay, thank you so much.
Okay, thank you.
Llevarte contigo, que sería un recuerdo de la pandemia.
Wow, pues definitivamente el lograr estos sistemas de integración de los municipios, que realmente para mí, más que establecer un sistema desde acá, desde el Departamento de Salud, es que se reconoció la importancia de los gobiernos municipales para atender a sus comunidades, porque son los gobiernos municipales los que conocen, y lo vas a ver cuando, o sea, yo lo veo mientras estoy trabajando con los distintos municipios, todos tienen servicios distintos, hay unos básicos, pero hay otros que son distintos. ¿Y por qué? Porque todas las poblaciones, todas sus comunidades son distintas.
Ha sido esta narrativa de que si eres saludable, si eres joven, pues que te infectes no es tan malo, porque, sabes, tú puedes combatir el virus y la enfermedad, y pues no afecta tanto a las personas jóvenes.
Expresar un ejemplo. Es que para mi opinión son muchas narrativas bastante erróneas, pero una que abarca muchas situaciones distintas, esta narrativa de bueno, este problema está ocurriendo en Puerto Rico y otros están peores que nosotros y no hay manera de buscarle, ¿verdad? O sea, está ocurriendo el problema en todo el mundo. Eso pasó con el asunto de las pruebas, con el asunto de la disponibilidad de ciertos productos, etcétera. Si bien es cierto que sí, todo el mundo estaba pasando por una situación similar, yo creo que esa narrativa le estaba diciendo al pueblo de Puerto Rico que teníamos que sentarnos a esperar porque las soluciones lleguen de afuera para entonces nosotros consumirlas. Y yo creo que eso es una narrativa, es mala durante la pandemia y es mala en todo momento. O sea, es una narrativa derrotista, a mi entender, y es una narrativa que simplemente no permite explorar. Y yo como científica, y estoy segura que, ¿verdad?, que muchos miembros de la comunidad científica, porque se habló de eso, hasta nos ofendemos porque entendemos que no es la actitud y que no es la naturaleza que deberíamos tener.
Yo creo que otra de las narrativas erróneas que todavía estamos viendo es el uso de las pruebas. sabemos que el poder hacer pruebas para detectar y para diagnosticar el coronavirus, ¿no? Infecciones con el coronavirus que causa la enfermedad COVID-19 es sumamente importante, es una piedra angular para nosotros poder mitigar la pandemia y controlar el virus y regresar, ¿no? a la nueva normalidad o establecer una nueva normalidad.
Nuestro planeta Tierra está en constante cambio. La evidencia histórica sugiere que desde los primeros rastros de existencia, el clima ha estado cambiando y nada sugiere que dejará de cambiar. Pero, ¿qué es el cambio climático? El cambio climático es un cambio a nivel global de forma acelerada de las condiciones del tiempo, donde los patrones usuales que definen el clima de una región se han alterado sin precedente. A través de la historia, los periodos de cambio del clima tomaron miles o millones de años. Sin embargo, en los últimos 100 años, el cambio está ocurriendo a una velocidad no antes vista. Los científicos han encontrado que las actividades realizadas por los seres humanos son responsables de estos cambios. La producción de energía, la eliminación de bosques, la generación en masa de desperdicios sólidos, entre otros, han provocado un incremento drástico en las emisiones de gases como el dióxido de carbono y el metano. Estos gases son responsables de cambios en las temperaturas globales y regionales. En Puerto Rico, el cambio climático promete efectos como son el aumento en el nivel del mar, sequías más prolongadas y frecuentes, aumento de temperaturas y la pérdida de ecosistemas marinos por la acidificación de los océanos. El cambio climático es un asunto actual, local y global. Lo estamos viviendo hoy. Tenemos un llamado constante a ser ciudadanos responsables y modificar nuestras actividades a unas más sustentables y amigables con la naturaleza, porque de esto dependen nuestras futuras generaciones.
Llevarte contigo, que sería un recuerdo de la pandemia.
Wow, pues definitivamente el lograr estos sistemas de integración de los municipios, que realmente para mí, más que establecer un sistema desde acá, desde el Departamento de Salud, es que se reconoció la importancia de los gobiernos municipales para atender a sus comunidades, porque son los gobiernos municipales los que conocen, y lo vas a ver cuando o sea, yo lo veo mientras estoy trabajando con los distintos municipios, todos tienen servicios distintos. Hay unos básicos, pero hay otros que son distintos. ¿Y por qué? Porque todas las poblaciones, todas sus comunidades son distintas.
Ha sido esta narrativa de que si eres saludable, si eres joven, pues que te infectes no es tan malo, porque, sabes, tú puedes combatir el virus y la enfermedad y pues no afecta tanto a las personas jóvenes.
Expresar un ejemplo. Es que para mi opinión son muchas narrativas bastante erróneas, pero una que abarca muchas situaciones distintas, esta narrativa de bueno, este problema está ocurriendo en Puerto Rico y otros están peores que nosotros y no hay manera de buscarle, ¿verdad? O sea, está ocurriendo el problema en todo el mundo. Eso pasó con el asunto de las pruebas, con el asunto de la disponibilidad de ciertos productos, etcétera. Si bien es cierto que sí, todo el mundo estaba pasando por una situación similar, yo creo que esa narrativa le estaba diciendo al pueblo de Puerto Rico que teníamos que sentarnos a esperar porque las soluciones lleguen de afuera para entonces nosotros consumirlas. Y yo creo que eso es una narrativa, es mala durante la pandemia y es mala en todo momento. O sea, es una narrativa derrotista, a mi entender, y es una narrativa que simplemente no permite explorar. Y yo como científica, y estoy segura que, ¿verdad?, que muchos miembros de la comunidad científica, porque se habló de eso, hasta nos ofendemos porque entendemos que no es la actitud y que no es la naturaleza que deberíamos tener.
Yo creo que
Filipa, Abel, yo le llevo el tiempo desde acá y le aviso a Abel por el WhatsApp. Que quede 2 minutos y 1 minuto a los estudiantes, ¿ok?
Perfecto.
Perfecto.
Muy bien. Pues ya estamos listos. Estamos en el aire, Félix.
No, 30 segundos. Silencio, por favor.
Bueno, comenzamos entonces con... Espero que estén todos aquí. Empezamos con Yanis. Yanis, estás aquí conmigo, ¿verdad?
Sí, los slides los tengo yo.
Ah, okay,
hola.
perfecto. ¿Y quién tiene el control? ¿El control lo tiene Filipa o lo tiene
Sí,
Yanis?
sí, lo tengo yo.
Perfecto, pues sepan todos que sus slides los tiene Filipa Godoy y que ella va a estar controlando sus slides y solamente tienen que decir la palabra mágica next slide.
Okay. Estamos en el aire.
Estamos en el aire, pues muy bien, excelente. Bienvenidos nuevamente a esta sesión de por la tarde. Vamos a estar haciendo las presentaciones orales, una excelente oportunidad para nuestros estudiantes de todo Puerto Rico para presentar sus trabajos, ¿verdad? Los trabajos que ellos realizan como estudiantes graduados. Al final de esto hay un premio, que es el premio Robert Larus, que se le da a pues, lo que entendemos que es la presentación que mejor representa a la división del Caribe de AAAS. Típicamente, esta presentación incluye un viaje a la convención anual de AAAS. Eso no está fuera del panorama, pero ahora de momento va a ser un premio en metálico de $500. También habrá premios para el segundo y tercer lugar. La primera presentación de esta tarde está a cargo de Yanis Lozada. Yanis, tienes 5 minutos.
Ok, me dejas saber cuándo empiezo.
Ahora puedes comenzar.
Okay, good afternoon. My name is Yanis Lozada, and the title of my presentation is Losartan inhibition of angiotensin II improves metabolic biomarkers in prediabetic rhesus monkeys. Next. Next, please. In Puerto Rico, the prevalence of diabetes is approximately 16%, one of the highest in the world. In the table below, you can see that diabetes is the main cause of death and disability in Puerto Rico, and is among the 5 principal causes of death in the Caribbean. Prediabetes is a condition characterized by elevated blood sugar levels that fall below the threshold to diagnose diabetes and is considered an important risk factor for the development of type 2 diabetes. Therefore, there is an urgent need for new interventions for the prevention and treatment of diabetes. Next. Studies have shown that angiotensin II induces insulin resistance and type 2 diabetes. And this suggests that the activation of the renin-angiotensin system, or RAS, may play a role in the onset of prediabetes. However, whether inhibition of RAS improves insulin sensitivity and glucose homeostasis in prediabetes has never been explored. Our hypothesis was that losartan, an angiotensin II receptor blocker, will ameliorate insulin resistance in prediabetic monkeys. And our objectives were to characterize a cohort of prediabetic rhesus monkeys from the Caribbean Primate Research Center, or CPRC, here in Puerto Rico, and to examine the effects of losartan on prediabetic metabolic biomarkers. Next, please. Our study was composed of middle-aged rhesus monkeys, and first, we performed a screening to identify the prediabetic monkeys, and our animal groups were composed of 8 healthy monkeys and 10 prediabetic monkeys, and these numbers were based on power analysis. Next. The prediabetic monkeys were treated with 30 milligrams of losartan per day, and we collected whole blood at baseline and at 3, 6, and 12 months after losartan treatment to measure glucose and insulin levels. We also measured body weight, body mass index, and blood pressure, which did not show any significant difference within the groups or after losartan treatment. Next. In the first graph, we observed that fasting blood glucose levels in both groups at baseline, and we observed that prediabetic monkeys that are shown in blue had significantly higher glucose levels when compared to the healthy monkeys shown in gray. In the right, it represents the insulin levels, and we observed that prediabetic monkeys had higher insulin levels, but it did not reach significant difference. In the lower panel, we also measured the quantitative insulin sensitivity check index in both groups at baseline, and this is used as a measure of insulin sensitivity. And we observed that prediabetic monkeys had significantly lower insulin sensitivity when compared to the control group. All these biomarkers were also measured at 3, 6, and 12 months after losartan treatment. And indeed, we observed that losartan improved fasting glucose, insulin levels, and it also increased the insulin sensitivity in the pre-diabetic monkeys. Next. In conclusion, we were able to characterize a cohort of pre-diabetic rhesus monkeys at the CPRC here in Puerto Rico, and our results suggest that the inhibition of RAS with losartan might be a novel pharmacological approach for the treatment of diabetes and the prevention of type 2 diabetes. Thank you.
Thank you very much, Janice. A wonderful presentation, and your timing was impeccable. Just so you guys know, Janice Lozada joins us from the Recinto de Ciencias Médicas of the University of Puerto Rico, the Medical Sciences campus. And right now we have another speaker, our next speaker, Jennifer Diaz, also is doing her work at the Medical Sciences campus. Jennifer, you have 5 minutes.
Good afternoon, everyone. My name is Jennifer Diaz Rivera, and today I'm going to talk about a tool we created in our lab called Machine Learning Synergy Predictor Tool to assess synergistic drug combinations in infectious diseases. Next. Malaria and tuberculosis are diseases caused by Plasmodium and Mycobacterium respectively. As we know, they are multi-drug resistant pathogens requiring combinatorial therapy. Drug combinations represent an approach to overcome and avoid the development of resistance. Nevertheless, the search for drug combinations can be time-consuming, but computational approaches like machine learning can be used to develop predictive models assessing synergistic combinations. For those who don't know, machine learning refers to the use of algorithms to categorize or predict data. Therefore, we ask ourselves if synergistic drug combinations can be predicted using machine learning, And our hypothesis is that machine learning models will allow the development of a tool to predict synergistic drug combinations, which improves treatment for drug-resistant diseases in the Caribbean and worldwide. Next. The most important part is how we created this tool. In the first step, we used as input the name of every drug under SMILE's representation. It is important to know that our input included 103 drugs, classifying them as antimalarials and antibiotics. In step 2, we generated the fingerprints and features for each drug alone and in combination. Mackey's and Morgan fingerprints correspond to the presence or absence of a substructure in a drug, representing them as 1 or 0 respectively. Also, we generated drug combinations for using all individual drugs, and we calculated the similarities in substructures by computing the average of their fingerprint. In step 3, we need to clean our data. In here, substructures with the same values for all drug combinations will be deleted. For example, if a substructure has all the values equal to 0 for all drug combinations, then the entire column will be deleted. And also, we added a synergy values for each drug combination. In step 4, after we clean our data, we applied a synthetic minority oversampling technique and a random undersampling technique to prevent data imbalance, which is a classification problem where the number of observations are not equally distributed. Our imbalance was between synergy values. And then we applied a recursive feature evaluation to select the most relevant substructures to run machine learning algorithms. In step 5, machine learning algorithms were implemented using the most relevant substructures to select the best model for prediction. The algorithms are random forest, logistic regression, gradient boost, AAAS, and support vector machine. And finally, we use a validation sets and compute different metrics like accuracy, precision, and area under the curve to select the best model. Once the best model is selected, it can be used to predict if drug combinations will be synergistic. Next. In the results, we determined that an IUC score greater than 0.7 will establish the best model. As you can see in the table at the left, random forest was the best model for antibiotics combination with a score of 0.88. And this is a classification method that uses multiple decision trees. In the table at the right, logistic regression was the best model for antimalarials combination with a score of 0.81. And this will predict the probability of an event using a dependent variable. These results are important because now we know that random forest is the best machine learning model to predict synergism between antibiotics, and logistic regression is the best machine learning model to predict synergism between antimalarials. Finally, this tool can be used to develop models to predict synergistic drug combinations, resulting in new combinatorial therapy and improved treatment for drug-resistant diseases in the Caribbean and worldwide. Also, it could be used for initial designs of preclinical strategies. Next. This is my presentation. Thank you for your attention.
Thank you very much, Jennifer. Thank you for staying on time. Just as a reminder, the questions will be saved for the end. So everybody will have a chance to answer questions that may come from either our attendees or from people watching us from Facebook Live and other platforms. Our next speaker is Mr. Joshua Medina Feliciano, who joins us from the Rio Piedras campus of the University of Puerto Rico. Joshua, you have 5 minutes.
Thank you. So good afternoon. My name is Joshua Medina, and today I'm going to be talking about the project titled New Sea Cucumber Draft Genome Sheds Light on the Evolution of MTF and ORPIN, 2 gene families involved in regeneration. Next. So I wanted to start talking about the sea cucumber Olothuria glaberrima, which upon evisceration, as you can see that is happening here in the video, it has the capacity to fully regenerate its intestine in about a month. So our laboratory has been studying this process for about 2 decades now, and most of the cellular events and the morphological aspects of this process is well understood by now. However, many of the molecular aspects are still unknown. So that brings us to our objective, which is develop new data that let us know more about this species at the molecular level. Next. So we started off by doing the genome assembly, for which we used DNA extracted from gonads tissue, and then was sequenced using Illumina. This was followed up using Platanus assembler for the contig assembly, and then for the scaffolding, we used MateMaker and S-Space. So this part of the project, as you can see in the bottom, totaled as 2 million scaffolds and a total of 1.5 of gigabases of size, with an N50 of 15 kilobases. Next. We then did the prediction using Augustus and performed the general statistics and assessed the completeness of both the assembly and the predictions using Busco. However, I wanted to focus today on the genome utility, which was assessed by doing the characterization of different candidate gene families, transferring and ORPing. Next. Starting by talking about transferring, this gene family was actually studied before by our laboratory, where they found out that the sea cucumber, compared to other species, appeared to have 4 different transcripts, while most of the species only show, all the species showed only 1. Moreover, these transcripts appear to be highly upregulated in different regeneration stages compared to non-eviscerated tissue. So our goal was to determine if these transcripts found were actually different genes located at different locations in the genome, or if there were isoforms of a single gene. And we found that there are actually different genes located at different locations in the genome, and that there's no more NTFs present in the sea cucumber. So by doing the phylogenetic analysis, we found out that another sea cucumber also showed more than 1 NTF gene, the Apostichopus japonicus, as you can see in the trees at the bottom, and that apparently this duplication event is specific for the whole fluoride lineage. Next. So also we wanted to assess this other gene family, the ORPing gene family, which appeared to be also highly expressed during regeneration stages of the intestine of the sea cucumber, and where these 2 different transcripts found actually shared 90% of sequence similarity. So when you think about this, you would expect that these 2 different transcripts should appear at different locus in the genome, but what we actually found is that these 2 different transcripts are part of a single genomic locus in the genome of the sea cucumber, sharing the last exon. And by doing other analysis, we also found that other isoforms could actually be formed that we are still haven't found on the transcriptome. Next. So the main takeaway of this whole analysis is that the draft genome data actually proves to be a great resource for the characterization of complex genomic components on the sea cucumber, and that these are only the initial steps toward the future evolution, studious evolution and functional genomics analysis on this Caribbean sea cucumber. So that would be all for me. Thank you very much.
Thank you very much, Joshua, for staying on time. Very interesting presentation. We're gonna move on with Mr. Cristian Malpica.
Hi, can you hear me?
Yes, we can hear you loud and clear. Okay. Cristian, it's all yours. You have 5 minutes.
Okay. Well, good afternoon. My name is Cristian Malpica. I'm a PhD candidate from Universidad Central del Caribe, and today I'm going to talk about polyamine uptake and synthesis in developing astrocytes and their role in connexin 43 hemichannel opening. Next. Well, unfortunately, highly active antiretroviral therapies do not protect HIV-infected individuals from developing HIV-associated neurocognitive disorder, also known as HAN. The detrimental effects of this disease on survival, quality of life, and everyday function, making an important unresolved issue. Next. Thanks to Sarin Merali, in 2014, he discovered that brain and cerebrospinal fluid of hand patients have high concentration of their acetylated form compared to normal. Also, we know that increased acetylation of polyamines occurs in the intracellular space of astrocytes due to expression and infection of HIV TAT protein. In our laboratory, we found that polyamines are accumulated in astrocytes and not in neurons. This suggests that polyamines are taken up into astrocytes to replenish the pool after acetylpolyamines are released. Next. So as you can see here in a figure of the hippocampus CA1 region of a mice, we can see in the red arrow, we have astrocytes containing spermine, while neurons in the green arrow does not contain spermine. Next. Now, our first objective was to determine the uptake and synthesis of polyamine by astrocytes. We resolved this objective in our publication this past summer, and we concluded that neonatal astrocytes synthesize sufficient quantities of polyamine de novo to support cell proliferation, but are also able to import exogenous polyamine from the extracellular space. Next. Our second objective is to determine the involvement of large pores of connexin 43 organic cation transporter on biotinylated spermine uptake. We have two major hypotheses on how polyamines are getting in the astrocytes. And as you can see in the figure in the top right, we have our connexin 43 hemichannels on blue and our organic cation transporters on green. If you see figure A, where I'm going to answer you how we're going to measure that polyamine entry in astrocytes. Well, we have our biotinylated spermine, and biotinylated spermine interacts with rhoavidin when we use Triton to permeabilize the membrane. When we permeabilize the membrane of astrocytes, rhoavidin can enter, interact with biotinylated spermine, and produce a red fluorescent that can be captured in confocal microscope. Our negative results will be the top figure, that the membrane is not permeabilized by Triton, so rhoavidin cannot enter the cell, so there is no interaction, and you can only see DAPID, which is the nucleus of the cell. To test the hypothesis if connexin 43 is a potential pathway, you can see in figure B, we use connexin 43 sRNA to knock down this hemichannel, and as you can see, we have our control in the red star versus our experimental group in the blue star. There is no statistical difference between them, so we can say connexin 43 hemichannel is not a potential pathway for polyamine uptake. If you see figure C, we use a polyamine transport inhibitor to block polyamine entry into astrocytes. If you compare our red star, which is the control, versus the blue star, you can see a huge decrease in cell fluorescence. So in conclusion, import is not blocked by connexin 43 sRNA, but appears to be blocked by polyamine transport inhibitor. Perhaps the polyamines are getting in the astrocytes through the organic cation transporter. It is also not excluded that connexin 43 hemichannel are a pathway for polyamine release from astrocytes. Next. In last objective, we would like to determine the effect of acetylated spermine on connexin 43 hemichannel opening. As you can see here, we have a diagram of the current that goes through the membrane of our astrocytes. When we use normal solution that has high calcium magnesium, you can see that the inward and outward currents is low. But when we add 1 millimolar acetylated spermine, there is a huge increase in the inward and outward current. So in conclusion, extracellular acetylspermine induced large ionic connexin 43 hemichannel current, suggesting the opening of a molecular signaling pathway between astrocytes and the environment. So in our overall summary, this novel information will give us the necessary tools to understand polyamine mechanics in astrocytes to then translate it to hand, in which polyamine flux is increased and there is a high concentration of acetylated polyamines. That will be all. Thank you.
Thank you, Christian. Thank you for that presentation. Very nice. Now, our next speaker is Marco Roche, who also joins us from Medical Sciences campus. He's going to be talking about post-traumatic stress. Marcos, you have 5 minutes.
Hola, ¿me escucho bien?
Loud and clear. Sí, te escuchas bien.
Okay. Hello, my name is Marcos Ivan Roche Miranda, and I am a first-year medical student at the University of Puerto Rico Medical Sciences campus. Today, I'll present to you the effect of post-traumatic stress disorder and childhood trauma in the ataque de nervios experience, preliminary data. Next. ataque de nervios affects 15 to 16% Puerto Ricans. It is a syndrome, a culturally bound syndrome among Latinx and Hispanic individuals characterized by an intense emotional upset resulting from a stressful or traumatic family-related event, such as an adverse childhood experience. The nature of ataque de nervios triggers associates the syndrome with post-traumatic stress disorder, which I'll be referring to as PTSD, and other affective and anxiety disorders. This study analyzed the effect of a PTSD diagnosis and childhood trauma in the expressions of ataque de nervios in a mostly Hispanic population living in Puerto Rico. We based our research around 3 questions. The first one, how does PTSD and the severities of the Childhood Trauma Questionnaire, or CTQ, relate to ataque de nervios questionnaire responses? Number 2, how does ataque de nervios symptom prevalence differ across the sample's categories? And number 3, do CTQ scores and ataque de nervios symptom prevalence relate? Next slide. We studied its manifestations through the ataque de nervios questionnaire, which was developed at the Center for the Study and Treatment of Fear and Anxiety, located at the University of Puerto Rico Medical Sciences campus. And this center also provided the inactive patient record data, which we use for the study. This ataque de nervios questionnaire assessed the subject's experiences of ataque de nervios through discrete and open questions. Our independent variables included PTSD diagnosis and childhood trauma questionnaire scores. The childhood trauma questionnaire is a self-report that measures 5 types of maltreatment experienced during childhood: emotional, physical, and sexual abuse, and physical and emotional neglect. Our statistical analysis included parametric and non-parametric tests of independence, analysis of variance, and correlations. We used an alpha level of 0.05. Our results suggest that both PTSD diagnosis and the severities of the sexual and emotional abuse components of the childhood trauma questionnaire increase the likelihood of conceiving an ataque de nervio event as traumatic. In terms of sex, males needed a PTSD diagnosis to suffer from ataque de nervios, while females suffered from ataque de nervios regardless of their PTSD diagnosis. If we refer our attention to the graphs on the right, we see that as the scores of the emotional abuse and emotional neglect components of the CTQ increase, there is also an increase in ataque de nervios symptom prevalence. This indicates a positive relationship between these 2 variables. Next. This study underlines the impact of PTSD and childhood trauma in Puerto Rican ataque de nervios experiences. How do we apply this to the pandemic? Well, we know that this pandemic has brought along a bundle of potentially traumatic lifestyle changes, and especially for the children, which will, all of these experiences will affect how these children will cope with these new circumstances. We conclude that the study of maladaptive responses under Caribbean context promotes culturally competent mental health care, especially to acknowledge the differences in realities we people in the Caribbean experience before applying North American approaches in treatments. Special thanks to Drs. Alicia Suerbi Vasquez and Dr. Karen Martinez for their constant support throughout the project. And thank you for listening and giving me the opportunity to present today.
Thank you very much, Marcos. I want to comment that all the speakers have stayed within the time. It's very impressive how you've all been able to give very complete presentations. Our next presentation, which should be loaded already, is that of Ms. Angelica Gonzalez, who joins us from the Mayagüez campus of the University of Puerto Rico. Angelica, you have 5 minutes.
Hi everyone, my name is Angelica Gonzalez, and my research title is Isolation of Specific Bacteriophage for Pseudomonas aeruginosa for wastewater from treatment plant in Mayagüez, Puerto Rico. I am from the University of Puerto Rico, Mayagüez. Next slide. As we know, antibiotics are drugs used to treat bacterial infection, and antibiotic resistance occurs when bacteria develop the ability to survive export to antibiotics. Today, it is a big problem due to overuse of antibiotics and improper use. In the United States, 2.8 million of people acquire infection from antibiotic-resistant bacteria, and these 35,000 people die each year as a result of this infection. The term scheme means bacteria of antibiotic-resistant emergent list, where Pseudomonas aeruginosa is your bacteria of interest. Pseudomonas aeruginosa is a multi-resistant pathogenic bacterium considered by the CDC has a several traits with urgent treatment needs. These bacteria are a nosocomial agent, an opportunity pathogen that affect patients with immune system problems, elderly and babies. It's found in the environment, mainly in the surrounding soil and water. These bacteria reduce the carbapenem enzyme, which causes to have between 2% and 3% camber resistance. Last from the antibiotic. In addition to affecting health, the resistance of the bacteria affects the economy. Infection treated with the bacteria spend $7 and $6 million of each year. Next slide. Next slide. Virus are pathogenic particles that infect a specific cell and use the whole cellular machinery for replication. The virus that are specific as a bacteria are called bacteriophage or phages and cannot reproduce independently without their host. In recent years, it has been recognized that phages have several potential applications in the modern biotechnology, alternative to antibiotics and the detection of pathogenic bacteria. The phage is specific for bacteria could provide the target therapy and leave human cells intact with less damage of the flora, unlike some antibiotics that cause toxicity in the host, additional low environmental impact. Next slide. In the methodology, the isolation of the specific phages of Pseudomonas aeruginosa was being made inoculation the filtered water with the bacteria. Water samples from the Mayagüez treatment plant were used at the same amount of water and double concentration of 11 medium were used. The solution make one concentration. It was incubated on 37 degrees for 48 hours. The sample layer that centrifugal and filter to obtain viral particles only. To determine the presence of the phage, use phages, plague assay or drop assay. In the plague assay, the phage and the bacteria will added to the top agar and then spilled onto the plate to obtain individual plagues to demonstration listing of the bacteria representing the phages. In the future, it is to expect the purification and application of the virus to make morphological and molecular characterization of the phage and to be able to sequence the sample. Next slide. As the result, the viral particle of infected Pseudomonas aeruginosa can be easily, can you see on the left, a phage listing of 2.5, 10B12, plaque forming unit per milliliter watt estimate, and the mean diameter of the plaque range is 0.8 at 1 millimeter. In the letter B is the amplifier of the plaque of the figure A. Other curve demonstrate the percentage of the phages. Additional to the right, you can see the data generated from the phage-specific test that was performed to determine that the phages are specific for Pseudomonas aeruginosa and do not infect other bacteria. In summary, I was able to isolate the phage of Pseudomonas aeruginosa in the water samples from the Mayagüez treatment plant to provide information for the generation of phage therapy. I thank you for everyone for my attention in my presentation. That is all. Thank you.
Thank you very much, Angelica. Very nice presentation. And questions will be asked at the end. Now we go to presentation number 7, which is Ms. Nicole Colon Carrion, who is joining us from the University of Arizona. So Nicole, you have 5 minutes.
Good afternoon. My name is Nicole Colon. I am a PhD candidate at the University of Arizona, and today I'll be presenting about responses of endophytic fungi in a Puerto Rican rainforest after Hurricane Maria. Next. Hurricanes have emerged as a primary abiotic factor driving deforestation in the Caribbean. These natural disturbances can have severe impacts on forest ecosystems and the plant communities within, as you can see in the images that I'm showing you today. Strong winds, heavy rainfall, and landslides can lead to severe deforestation, uprooting of the trees, and damage of the matured canopies, reshaping the entire ecosystem. Next. And although the effect of these hurricanes on the plant communities had been studied extensively, little is known about how these disturbances affect the microbial communities that live within the plant and are essential for plant establishment and survival in these ecosystems. And in my project, I address that question, but I focus on a particular group of microbes known as fungal endophytes. These are fungi that live within the plant tissue without causing any harm. On the contrary, they're said to be beneficial, providing the plant with increases in stress tolerance, protection against pathogens, and increases in plant growth and development. And they also play significant roles in forest health and ecosystem functioning. So based on that, my goal is to understand how these hurricanes, specifically how Hurricane Maria that occurred in 2017, affected the community of these fungal endophytes in tropical forests in Puerto Rico. Next. And in order to assess that, I surveyed forest damage at 3 locations in El Carito Forest using the canopy model after the hurricane. And I move on into collecting plant tissue from those locations. And finally, I identified the fungi within those tissue through next generation sequencing. And I based my prediction on an ecological model known as the intermediate disturbance hypothesis. And this is a hypothesis used to explain how damage done by the disturbance, in this case, forest damage due to a hurricane, affects the number of presence of species, in this case, the presence of these fungal endophytes in the tissue that I'm sampling. And the idea behind the model is that you will have low number of species at low and high levels of disturbances. This is because in low disturbances, you have high competition. So you have good competitors wiping out the bad competitors, while at high levels of disturbances, only the most adapted species are surviving. And when we look at intermediate levels of disturbance, the idea is that you're creating a balance that allows for a higher number of species to be present and to coexist. And I'm basing my hypothesis on this model. I hypothesize that the species richness of these endophytes will be higher where the hurricane disturbances were intermediate. Next. And in order to test that hypothesis, I first analyze the relationship between forest damage, which is shown in the x-axis, and the presence of these fungal endophytes in the leaf tissue of the plants that I sampled, which is shown in the y-axis. And in the graph, you can see individual dots that are color-coded with different sizes. Those dots represent the plant's individuals that I sampled, the colors, the plant family they belong, and the sizes or fertility. And what you can observe in these results is low levels or low number of endophytes at low and high levels of disturbances. But when we look at intermediate levels of disturbances, we're seeing a peak, which is consistent with our model, the intermediate disturbance hypothesis. And when we analyze this relationship, it is significant. Next. So based on this data, we can conclude that there is a significant relationship between the presence of these endophytes in the leaf tissue and the damage done by the hurricane that is speaking at intermediate disturbance consistent with our model. But we can also conclude that these fungal endophytes are being sensitive to these environmental disturbances and affected by it. And understanding how these disturbances are affecting this microbial symbiosis is essential to provide effective and immediate applications for the reforestation of hurricane damaged lands in the Caribbean and around the world. Thank you.
Thank you very much, Nicole. Very nice presentation. And now for the last bit of science. I'd like to congratulate all of you. You guys have done a fantastic job of synthesizing very complex research into 5 minutes. And the last one this afternoon is Ms. Natalie Melendez Vasquez, who joins us from the Medical Sciences campus of the University of Puerto Rico. Natalie, you have.
Thank you so much for having me here. My name is Natalie Melendez. I'm a microbiology PhD student from the University of Puerto Rico at the Medical Sciences campus, and I work at the Godoy Lab. Today, I'll be presenting the project, which is in collaboration with Dr. Guillermo Ortiz from UPR Mayagüez, and it's funded by the Puerto Rico Department of Agriculture, and it's titled Comparative Analysis of Foregut and Hindgut Bacterial Communities in Slick and Wild-Type Holsteins in a Tropical Climate. Next. As we all know, throughout the years, climate change has taken its toll on the world, affecting greatly animal livestock. Particularly, climate change will be key for further expansion of hotter and longer hot seasons, which will expose animals to chronic heat stress, a challenge very much present in the Caribbean and Puerto Rico. Different studies have documented how heat stress affects both milk production and reproductive efficiency in cattle. Therefore, a valuable strategy to decrease the severity of the heat stress impact on dairy cattle is through the selection of thermal-tolerant improved animals. Particularly in dairy cattle, the slick gene has developed, where cows exhibit a very short, sleek, and most glossy coat, which can be observed in panel C of the picture, as well as a higher yield of milk production, thermal tolerance, and reproductive efficiency. This gene was introduced to the criollo cattle of Puerto Rico in the early 1500s when European cattle arrived at the island and local farmers decided to cross both breeds. Therefore, as slick and wild type or normal hair type cow phenotype experience heat stress differently, we hypothesize that under heat stress conditions, both cow phenotypes will have a different rumen and hindgut microbiome. Next. To test our 8 wild type and 7 slick Holstein cows, from which we obtained a total of 117 salmon and hindguts. These samples were then subjected to DNA extraction and amplification of the 16S RNA gene was conducted. We then performed high throughput sequencing, and with the use of different bioinformatical tools, we analyzed the data. Next. Our first approach was to look at the structure and composition of our samples. When we consider the samples all together, which would be panel A of the figure, we see similarities in the composition of rumen and hindgut, but not on cow phenotype. Nonetheless, when we separate according to sample site being panel B, the rumen samples of slick and wild, and panel C, the hindgut samples of slick and wild, we see significant differences on cow phenotype. Next. We then continued looking at the alpha diversity plots, which are on the left-hand figure. In order to understand the richness or number of species, we use the Chow-1 index, and for diversity, we use the Shannon index. In this case, we observed significant differences in the bacterial community diversity of rumen samples, but not on hindguts. On the other hand, we observed significant differences in the richness of hindgut samples, but not rumen. When we look at the right-hand figure, we see a bar plot at phylum level of the 4 categories. And even though we observe the same phylogroups among all categories, there is a distinction between rumen, hindgut, and phenotype. Particularly, we see an increase of the Euryarchaeota phylum in rumen samples, especially in the slick phenotype, while for the hindgut samples, we observe an increase of spirochetes. Next. Now that we've seen changes in the bacterial community structure, richness, and diversity of the rumen and hindgut samples, we then asked ourselves, what bacteria change in abundance to become characteristic or potential biomarkers? Therefore, we proceeded to do a biomarker analysis where we saw a prevalence of the phylum Euryarchaeota in the rumen samples from slick, seeing a distinction of the genus Methanoberibacter. For the hindgut samples, we saw a prevalence of spirochetes and verrucomicrobia in the slick phenotype, seeing a distinction of the genus Alistypes. Next. Overall, our data demonstrates the existence of differences between the rumen and hindgut microbiomes of both cow phenotype. Particularly, we see a dominance of spirochetes and methanogens in slick cows, which may be associated with an increase in productivity, as methanogens play an important role in the fermentation process. Therefore, our data may further explain the differences of dairy production and reproductive efficiency seen in slick cows. Thank you so much for your attention.
Thank you very much, Natalie. That was very nice. They were all super great presentations, so I'm sure the judges are going to have a very hard time assigning these points for these presentations. But before that, I mean, let's just enjoy the fact that we've had the chance to present our work. And we have several questions. I have so many questions right here for you guys. It's not even funny. We've received a complete barrage of questions through the internet sites and through the social media. So you guys are right now the most watched scientists in all of Puerto Rico. first question is for Janice. Janice, are you there with us?
Yes, I am here.
It's a general question. What are the next steps in terms of the development of losartan for the treatment of diabetes or pre-diabetes?
Yes. So in our future experiments, we are planning to measure proteins that are involved in mitophagy, in fusion and fission, and we are also measuring DNA damage using skeletal muscle tissue. So those are some experiments that are on their way. And yeah, that's most of my thesis.
Thank you. The other question is for Jennifer Diaz. And it has to do with the different methods that were evaluated, different models that were evaluated for the different machine learning algorithms.
Yeah.
And the question is that some of them, like the top performers, were only separated by very small margin of percentage. And the question is how can you assign, how are you treating the statistics? How do you know what are the uncertainty for each one of those numbers? How do you really know that one is 3 percentage points better than the other?
So basically, that's why we use the area under the curve, because once we establish the measurement greater than 0.7, then we can we have the ability to distinguish between those models and to say, okay, so if this one is higher, then this is the best model.
Great, thank you. And another question is for Joshua Medina.
Yes.
And it says, do you think that all your genes are co-evolving inside a gene cluster?
Well, I don't think so. I don't think that's really the case, because there are other genes that have maintained their evolution status, and not many of them follow this duplication that we've seen with ORPI and MTF. I don't know if that answers the question, but.
So you do not think that all the genes involved in the regeneration of the sea cucumber digestive tract are located within a locus, or that are
No, not at all. No.
Great, thank you. Do you have evidence to that? I mean, you do know some of the genes, right?
Well, yeah, we have analyzed a lot of the genes, not only in the genome, but also in RNA-seq data. And genes that are actually involving regeneration that we've seen with RNA-seq data show actually a conservation between species. So not all of them show this kind of evolution.
Great, thank you. And I have another question for Marcos.
Hola, hello.
Hola, Marcos. It says, besides childhood trauma or childhood trauma, what other parameters were evaluated to explain the increased ataque de nervios incidence?
Yeah, well, besides the PTSD and the childhood trauma questionnaire, we also used different demographics. And those demographics were included nationality. It's just that we included various other demographic variables, but not all of them showed significant results. So I just included the most significant. It was a big study, relatively big study. But yeah, the most significant were sex, when there were differences between males and females in the representations of ataque de nervios, and the differences in the CTQ scores. I don't know if that answers the question, but yeah, whoever did the question can contact me, and we can go over the details if they want.
That would be great. Yes, I'm sure this is a great opportunity for that. So some of the people who are asking questions are going to know your names from the program, are going to be able to get in touch with all of you and clear that up. So there's a great opportunity for that. Nicole Colon? Yeah.
Yes.
Yeah, Nicole. Yes. So there's a question for you. It says you mentioned the fungal biota post-Maria, but did you have samples from pre-Maria? So were you able to, have you been able to compare the pre-Maria versus post-Maria fungal biota?
Unfortunately, I wasn't able to do that because I started this project in my first year of grad school. So I was moving from undergrad to grad school, and we decided after Maria to tackle this problem of can we develop good reforestation methods implementing these fungal endophytes that are necessary for these plants to survive in this really harsh climates. But unfortunately, the answer to the question is no, I don't. We wish we could have them so we can compare the microbiota of pre-Maria and post-Maria, but to this day, we don't have that information.
And is there anything in the literature that you can go by in terms of people, other researchers that may have done similar studies on this microbiota in similar ecosystems?
I can go into the literature with similar ecosystems, but not with samples that have been taken from Puerto Rico.
Okay, I see. Well, thank you so much.
Thanks.
So we have a question for Christian.
Hi, I'm here.
Okay, Christian. So the question is the following. Is there anything that is known about how polyamines might play a role in cell proliferation?
Yes, the paper we published this summer, we did some proliferation tests and some new drugs with DFMO and PTI. With DFMO, we inhibit their synthesis. So now we know that they are synthesized also in neonatal astrocytes. And we use also the same drug as I discussed in objective 2, which was PTI. It was polyamine transport inhibitor, and it did nothing to the cells. So they are the polyamines are very good with cell division, proliferation, and differentiation.
Excellent. Thank you very much. Another question for Mr. Roche.
Okay.
Marcos Roche.
Yes.
And it is, how does ataque de nervios and PTSD, how has it changed in Puerto Rico after adding multiple stressful events like hurricanes, earthquakes, and COVID-19? Is that something you've looked into?
Well, it's definitely part of the things I would like to add on to this study, because all of this data is pre-Maria, pre-earthquakes. So my theory, my hypothesis is that the expressions of ataque de nervios, who knows, they could get worse, they could get increase in intensity. Who knows if they even add to the symptomatology of ataque de nervios, because Puerto Rico's been through a lot. It's not only the hurricanes and the earthquakes, but the political disaster, the political environment, the socio-economic circumstances, they all amount to ataque de nervios expressions. I only went through a family-related event, but it does not limit to family-related events.
Great, thank you, Marcos.
Thank you for your questions.
And another question for Ms. Natalie Melendez.
Yes.
Great. So Natalie, I have a question regarding the microbiome, the microbial distribution in rumen and hindgut of cows. Is this a variable that you think farmers will be able to control in any way, or how do you see this playing out in terms of milk production and how farmers could control microbiome in cows to affect milk production in positive ways?
Yes. So it's really important the organisms that are found in these gut sites, as they play critical, they have important roles in the critical processes of fermentation. So in the case of slick, we see a dominance of methanogens and spirochetes, and these microorganisms are key in the fermentation processes. So if we have a greater prevalence of these organisms, we have a better fermentation process, and therefore the cow obtains their nutrients faster, and therefore the milk production will be higher as to those cows that don't have these organisms in higher prevalence.
Great, thank you so much. And finally, we have a question for, let me see who it was for. Oh, Miss Angelica Gonzalez. I saw the question, but it wasn't directed at you, but from the topic of the question, me imaginé que era usted, Angélica.
Yes.
Sí, the question is how, you know, now you've isolated the phages that infect Pseudomonas aeruginosa. And the question is, what is going to be done next with the phages? What is the next step in this research now that the phage has been identified?
Is to make characterization morphological with microscopic stem to determine the head and the tail of the symmetry of the phages. Later is characterization molecular to determine in sequencing and analyzing in silico for these phages to know is a new phages or other phages that exist.
Excellent, thank you. The other question I had is if you have other specific Pseudomonas aeruginosa phages that you can compare against. You have a positive control for, you know, if you wanted to know how toxic your phage is in comparison with another Pseudomonas aeruginosa phage. Is there a comparison, basis of comparison?
I made the specific test with other species of Pseudomonas aeruginosa, but this affects only the Pseudomonas aeruginosa.
Oh, I see.
Yes. Yes.
So the toxicity, you have not really assessed the toxicity profile
Exactly.
of this phage.
Exactly.
Okay. I see. So that's important. You
Yes.
will do that at some point. Yes, that's good.
Yes.
Okay. So I have, wow, there's so many questions here. Nicole Colon. This is another, I just spotted a new source of question, brand new source of fresh questions for you guys. So the question is, would you expect similar results given different types of ecological disturbances in these environments? Namely, instead of hurricane, if the forest was impacted by a fire, would you expect a similar impact in terms of the microbiome?
We actually do. Our lab focuses on differences, disturbances. My project specifically for hurricanes, but another member in our lab focuses on fires, and we are able to see similar patterns. Not exactly the same, but really close to that model.
Okay. Excellent. Thank you so much. And we have a question for Natalie Melendez again.
Yes.
The question is whether a comparison has been made between slick cows that have been exposed to heat stress versus slick cows that have not been exposed to heat stress.
I'm not really sure. The literature I've seen, it's been comparing both cow phenotypes in heat stress conditions. I haven't really seen a data comparing one where the wild type isn't exposed to heat stress conditions.
Okay, excellent. Okay, well, I think we're running fairly low on time. I'm going to open the floor for any questions that other attendees may have, or some of the organizers could ask their questions directly to the panelists. Or maybe you guys want to ask questions amongst yourselves.
I have a question from Giovanna, who wasn't made yet.
Okay.
For Christian on the polyamine astrocytes. She says, my question was more about mechanism. How would PA affect proliferation? Problem not being able to make my question directly, so I'm giving.
Okay. So polyamines are positive organic compounds that are present in all cells. So they mostly interact with DNA and other growth factors that promote cell proliferation.
What applications do you foresee for your work?
Okay, well, right now we are studying the mechanism in astrocytes, how they enter astrocytes so they can become acetylated polyamines. But in the future, we would like to express NMDA and AMPA receptors on HEK cells, human embryonic kidney cells, to test the effect of acetylated polyamines in those HEK cells trying to be
We can't hear you.
Se frizó.
Se frizó.
Well,
so I have a comment for Nicole. You have a very nice work. It's not a comment, it's a suggestion. There's a professor here in Puerto Rico. Oh, sorry, I think he's coming back. No. So there's a professor here at Universidad del Turabo, Sharon Cantrell. She has a PhD student working on soil fungi, pre and post Maria, but he has a specific transect. Perhaps it would be good to talk to them. Sharon
That will be amazing, yeah. Thank you.
So great. So I think we've reached the end of this session. I want to congratulate all of you, all of the students that presented today and the ones that presented yesterday. I think you've made our conference a lot richer for your presentations. I think your work is very valuable regardless, and this opportunity to, regardless of the outcome of, you know, the judges and all these prizes and all that. I mean, of course, we congratulate the winners, but we also congratulate everyone, because every opportunity to present one's research is a treasure, and you guys have made the best out of it. So thank you so much for participating and supporting this activity, and we hope to see you in the following years. Right now, we're gonna move on to the next portion conference, which is the presentation of the Lucy Gaspar Award. El premio Lucy Gaspar es el premio a la excelencia en la enseñanza de la ciencia y las matemáticas. Y es un premio que se otorga todos los años como parte de un proceso muy riguroso de evaluación de múltiples candidatos a maestros y maestras de ciencia que tienen un impacto grande sobre la vida de sus estudiantes y sobre la enseñanza de la ciencia. Se nombra el premio, ¿verdad? El premio lleva el nombre de la maestra Lucy Gaspar, quien fue maestra de ciencia de toda la vida, fue principal de la escuela de la Universidad de Puerto Rico, pero sobre todo participó en actividades de capacitación de maestros y fue una líder magisterial en el ámbito de la ciencia. Y fue una figura muy importante para esta división del Caribe, ya que fue miembro de esta organización y fue miembro de la junta directiva. Para presentar el premio voy a dejarlos con Filipa y con Jessica Gaspar, que es la hija de Lucy Gaspar, que en paz descanse, que desde hace ya unos cuantos años no está con nosotros. Pero dejo a Filipa y a Jessica para presentar el premio. Filipa.
Yo no lo voy a presentar. Quien va a presentar a Jessica es su amigo Jorge Colón, que está aquí al teléfono y no pudo entrar por problemas de internet. Así que paso la voz a Jorge. Espero que lo escuchen. Confirmen si lo escuchan, por favor.
Buenas. Jorge Colón aquí. Gracias, Filipa. No sabía si debo hacerlo en inglés o en español.
Quizás en español para todos los profesores de Puerto Rico, ¿no?
Bueno, cómo no. Quería, primeramente, antes de presentar a Jessica, quería, antes que nada, reconocer que estamos hoy celebrando precisamente la 35 conferencia anual de la División del Caribe AAAS, y que, pues, particularmente en este aniversario queremos rendir tributo a Lucy Gaspar, quien fue una verdadera pionera en promover y en el desarrollo de la ciencia y educación científica en Puerto Rico. Y recuerdo que cuando celebramos hace 10 años atrás los primeros 25 años de la división caribeña, también todos nos reconocíamos lo asombroso que era que Lucy había sido nuestra secretaria tesorera por 23 de esos primeros 25 años. Ella realmente era, ¿verdad? Me mantenía la memoria histórica de nuestra división y era completamente, ¿verdad? Nos apoyaba completamente en todo nuestro trabajo recibía con mucho entusiasmo a los nuevos miembros de la Junta de Directores cuando entrábamos, y para aquellos de nosotros que nos convertimos en presidentes, ella también nos apoyaba con mucho entusiasmo, no importaba las ideas medias locas que traíamos para la división. Ella estaba siempre feliz en apoyarnos en ella, era muy dadivosa en darnos consejos también a los jóvenes científicos y sus estudiantes que tanto, así que la extrañamos muchísimo. Y por eso es que decidimos que el premio para la excelencia en educación científica se la teníamos que dar a nombre de ella. Así que nos honra que su familia pues siempre ha apoyado, que desde que nombramos el premio a nombre de ella, siempre ha apoyado el poder participar en nuestras conferencias anuales, y particularmente su hija Jessica Gaspar, que es profesora en la Universidad de Puerto Rico, recinto de Calle, que también nos apoya todos los años y nos entusiasma que este año pueda estar con nosotros y que pueda leer la semblanza de la ganadora de este año del premio Lucy Gaspar de excelencia en educación en ciencia. Así que Jessica, si estás por ahí, este es el momento. Gracias.
Primero, muchas tardes a todas y a todos. Gracias nuevamente por continuar otorgando y dándole visibilidad al legado de mi mamá. Así que a nombre mío y de toda la familia Gaspar Concepción, agradecemos esto. Quisiera leer la semblanza de la profesora Elizabeth Torres Rodríguez. La División Caribeña de la Sociedad Americana para el Avance de las Ciencias, AAAS, por sus siglas en inglés, otorga el premio Lucy Gaspar a la excelencia en educación en ciencias para el año 2020 a la profesora Elizabeth Torres Rodríguez, maestra en ciencias de la Escuela de la Comunidad Especializada de Teatro José Julián Acosta de San Juan, por su compromiso con el diseño de actividades científicas, tanto para maestros como para estudiantes. La profesora Torres encarna los ideales de excelencia y de pasión por la educación en las ciencias que este premio representa. La profesora Elizabeth Torres comenzó su carrera universitaria en pedagogía en el recinto de Arecibo de la Universidad de Puerto Rico y posteriormente se graduó del recinto de Río Piedras con un bachillerato en educación en ciencias. Desde el año 1995, la profesora se desempeña como docente en la Escuela José Julián Acosta, donde ha ofrecido cursos en las áreas de ciencias terrestres, ambientales, biología y química. En el año 2004, la profesora Torres obtuvo una certificación graduada en meteorología y predicción climatológica en la Universidad del Estado en Pensilvania. En el año 2005, pasa a ser parte de la facultad afiliada al consorcio NASA Space Grants de la Universidad de Puerto Rico. Su participación en este programa ha llevado a la profesora a representar a Puerto Rico en numerosas actividades para la capacitación de maestros y maestras en el área de ciencias climáticas, robótica y exploración del espacio. Incluso la profesora Torres fue la primera puertorriqueña en ser invitada a la prestigiosa Academia Espacial para Maestros de la NASA hace 2 años. En el año 2001, la profesora Torres completó su grado de maestría en salud ambiental del recinto de ciencias médicas y actualmente cursa estudios conducentes a su doctorado en ciencias ambientales en el recinto de Río Piedras. Claramente, la profesora Elizabeth Torres se ha preparado de manera completa y rigurosa para su vocación magisterial. Pero más allá de sus logros individuales, la profesora ha puesto su preparación al servicio de sus colegas y sus estudiantes, al haber organizado numerosos talleres para maestros en áreas de climatología y exploración espacial. También ha organizado numerosas actividades para estudiantes en áreas de robótica y tecnología. Son estas últimas actividades de impacto en la comunidad docente y estudiantil las que hacen a la profesora Elizabeth Torres merecedora del premio Lucy Gaspar a la excelencia en la enseñanza de las ciencias. Muchas gracias, profesora.
Muchas gracias, Jessica. Profesora Torres, si está por aquí, nos gustaría que nos diera unas palabritas.
Sí, buenas tardes a toda la distinguida audiencia que nos acompaña. A Jessica Gaspar, muy honrada de que presentes el premio a nombre de tu mamá. Les agradezco a todos en el día de hoy la invitación y este premio. Es para mí un honor. el 17 de enero del 2020, después de una secuencia de sobre 2.000 sismos en el área suroeste de Puerto Rico, la NASA reveló unas imágenes tomadas por el satélite Copernicus Sentinel-1, que revelaron que hubo un cambio en el relieve de la zona suroeste. El suelo se hundió y se movió ligeramente hacia el oeste, y ahora con esta nueva realidad de la pandemia que estamos viviendo, continúa moviéndonos el piso, desplazando la antes normalidad de mi país en todos los aspectos, con especial atención en la educación, en los estudiantes, en los maestros y hasta en los padres. Es por ello que se ha convocado y activado todos los agentes educativos con un norte y elevada conciencia sísmica para mantener en pie esos cimientos del pilar fundamental de la educación, aunando los esfuerzos para construir un estudiante resiliente que emerge en un nuevo escenario y con unas nuevas herramientas, sin olvidar el reto que hoy enfrentamos todos los docentes en Puerto Rico. Y esta ahora es nuestra realidad, que no le era ajena a la maestra de maestros, la señora Lucy Concepción de Gaspar. Mujer, madre y maestra visionaria, quien a través de soñar y la puesta de acción de múltiples iniciativas, desarrolló ambientes y escenarios donde ella expresara, ahí se fortalecía el vínculo entre maestros y estudiantes, para así poder avanzar la ciencia a la par con los procesos educativos. En un día del mes de abril del 2012, el piso volvió a moverse con la triste partida de la profesora Gaspar, dejando y perpetuando un incalculable legado en Puerto Rico, tanto para maestros como para estudiantes. Por ello, yo me siento profundamente honrada en ser reconocida con el premio de una educadora y modelo que lleva su nombre. Cabe destacar que durante mis comienzos en la docencia tuve la oportunidad de compartir varias veces con ellas en varias de las convenciones de la Asociación de Maestros de Puerto Rico de Ciencia. Este reconocimiento ahora mismo es compartido con todo Puerto Rico, en especial con la comunidad escolar de la Escuela de Teatro del Viejo San Juan. Me emociono, perdón. Con mis estudiantes, maestros, personal administrativo de apoyo, porque no los puedo dejar atrás, mantenimiento y muy particular con los padres, con los cuales ahora, en momentos desafiantes de la historia que estamos viviendo, hemos fortalecido vínculos y compartido procesos de aprender a aprender. Mi más profundo agradecimiento a la Asociación Americana para el Avance de la Ciencia por este reconocimiento, a Jessica Gaspar por estar hoy aquí también presente y por mantener alto, apoyar y reconocer la gesta de los educadores en Puerto Rico. Muchas gracias.
Muchísimas gracias. Nos emocionamos todos. Tienes toda la razón. Puerto Rico tiene muchísimo que dar al mundo. Puerto Rico tiene mucho valor. La gente de Puerto Rico tiene mucho valor. Yo soy hija adoptada de Puerto Rico. Yo no soy puertorriqueña, pero lo soy de corazón. Y reconozco el enorme valor que tienen estudiantes, profesores, maestros, los papás que están en las casas trabajando hasta tardísimo, y la casa es una escuela, y es un laboratorio, y es una cocina, y es un playground. Así que estamos todos de felicidades. La palabra, we have to congratulate ourselves for what we're doing and what we're giving to society. La verdad, y muchas felicidades de nuevo, profesora Torres, por su reconocimiento. A nombre de toda la Junta, nos honra que haya sido seleccionada este año. A los demás profesores, hay muchos profesores de valor, muchos aplicaron. Los exhortamos a que sigan aplicando. Cada año tenemos un reconocimiento a un profesor extraordinario. Debe tener el apoyo de su escuela, de sus colegas, de sus pares. Y al igual que los estudiantes, solo fueron algunos seleccionados para los 2 días por la cuestión del tiempo, pero tendrán oportunidad el año que viene ¿verdad? En la 36ª reunión de poder competir y poder compartir su ciencia con nosotros. Vamos a hacer una pausita de 3 minutos solamente para recopilar el puntaje de los estudiantes de las presentaciones orales. y en 3 minutos regresamos de nuevo para la presentación de los premios de los estudiantes. ¿Ok? No se vayan. Quédense con nosotros, por favor.
Llevarte contigo, que sería un recuerdo de la pandemia.
Wow, pues definitivamente el lograr estos sistemas de integración de los municipios, que realmente para mí, más que establecer un sistema desde acá, desde el Departamento de Salud, es que se reconoció la importancia de los gobiernos municipales para atender a sus comunidades, porque son los gobiernos municipales los que conocen, y lo vas a ver cuando, o sea, yo lo veo mientras estoy trabajando con los distintos municipios, todos tienen servicios distintos, hay unos básicos, pero hay otros que son distintos. ¿Y por qué? Porque todas las poblaciones, todas sus comunidades son distintas.
Ha sido esta narrativa de que si eres saludable, si eres joven, pues que te infectes no es tan malo, porque, sabes, tú puedes combatir el virus y la enfermedad y pues no afecta tanto a las personas jóvenes.
Expresar un ejemplo. Es que para mi opinión son muchas narrativas bastante erróneas, pero una que abarca muchas situaciones distintas, esta narrativa de, bueno, este problema está ocurriendo en Puerto Rico y otros están peores que nosotros y no hay manera de buscarle, ¿verdad? O sea, está ocurriendo el problema en todo el mundo. Eso pasó con el asunto de las pruebas, con el asunto de la disponibilidad de ciertos productos, etcétera. Si bien es cierto que sí, todo el mundo estaba pasando por una situación similar, yo creo que esa narrativa le estaba diciendo al pueblo de Puerto Rico que teníamos que sentarnos a esperar porque las soluciones lleguen de afuera para entonces nosotros consumirlas. Y yo creo que eso es una narrativa, es mala durante la pandemia y es mala en todo momento. O sea, es una narrativa derrotista, a mi entender, y es una narrativa que simplemente no permite explorar. Y yo como científica, y estoy segura que, ¿verdad?, que muchos miembros de la comunidad científica, porque se habló de eso, hasta nos ofendemos porque entendemos que no es la actitud y que no es la naturaleza que deberíamos tener.
Yo creo que otra de las narrativas erróneas que todavía estamos viendo es el uso de las pruebas. Sabemos que el poder hacer pruebas para detectar y para diagnosticar el coronavirus, ¿no? Infecciones con el coronavirus que causa la enfermedad COVID-19 es sumamente importante, es una piedra angular para nosotros poder mitigar la pandemia y controlar el virus y regresar, ¿no?, a la nueva normalidad o establecer una nueva normalidad.
Nuestro planeta Tierra está en constante cambio. La evidencia histórica sugiere que desde los primeros rastros de existencia, el clima ha estado cambiando y nada sugiere que dejará de cambiar. Pero, ¿qué es el cambio climático? El cambio climático es un cambio a nivel global de forma acelerada de las condiciones del tiempo, donde los patrones usuales que definen el clima de una región se han alterado.
Ajá, ver qué background tengo en Puerto Rico por ahí.
Estamos live,
¿Este les gusta?
¿Estamos live o qué?
Ese está bueno, ese era el gato, el canal del gato.
El gato. Wow, el gato.
¿Te acuerdas del canal del gato?
Sí,
Claro.
seguro.
Gente,
Bueno,
no sé si estamos live. Ok. Pues muchas gracias por seguir ahí. Bienvenidos a la última parte del día 2 del meeting anual de la AAAS División del Caribe de 2020. Esta última parte se la dedicamos a los estudiantes y felicitamos a todos los participantes del día 1 y del día 2. Voy aquí a compartir mi pantalla para enseñar los ganadores. En primer lugar, la señora Carmen Pérez recibe $500 y tiene la posibilidad de mandar su abstract al meeting anual de AAAS que extendieron el portal para la División del Caribe hasta el día de mañana. En segundo lugar, la señorita Janice Lozada, $300. Muchas felicidades. Y en tercer lugar, Gabriela Ramírez con $100. Pero todos realmente son ganadores. O sea, no se pongan tristes porque todo el mundo ha reconocido el valor de ustedes, de vuestros mentores, todo el esfuerzo que han hecho durante un año dificilísimo. Es realmente extraordinario todo el trabajo que hacemos en Puerto Rico y es bueno que la comunidad lo sepa y lo aplauda. Desde luego, la Junta de Directores de la AAAS está muy orgullosa de todos ustedes. Así que un aplauso virtual para todos. Sin más preámbulos, quería simplemente comentarles a los panelistas, los que todavía siguen aquí, los que nos ven desde las casas, que a modo de gift les dejamos un Domicu, que es una mesa de dominó súper original, hecha en Puerto Rico por artistas puertorriqueños. Escogimos de esta vez la Capilla de Cristo. Es un monumento simbólico, ¿verdad? Y es un monumento un ex libris de la cultura puertorriqueña en el Viejo San Juan. y es también un símbolo de esperanza. Así que espero que disfruten vuestro dominó, que es muy bello. Y agradezco a toda la Junta por haber hecho este increíble evento. 2 días, 5 horas. Fue realmente increíble. Todo el mundo ha dado el litro. Así que muchas gracias a todos. A nuestros partners, Vistazo a la Ciencia, Félix, me quito el sombrero por todas las cosas increíbles que estás haciendo. Enrique Rivera, igual, muchísimas gracias, Ecoexploratorio, por permitirnos hacer este evento. Ciencia Puerto Rico, por siempre darnos la mano y mandar la información a las redes y estar siempre apoyando todos los eventos de la AAAS División del Caribe. A los intérpretes de Ceiba Interpreters, que han estado non-stop con nosotros desde el principio, día 1 hasta ahora, han estado los intérpretes dando acceso a la ciencia a la comunidad sorda. Y otros amigos que han colaborado, Abdiel Reyes, que hizo de manera gratuita el vídeo el primer vídeo sobre el meeting que se pasó por las redes sociales, Kevin Alicia, que va a escribir una reseña sobre el meeting de hoy, el profesor Bolaños, la profesora Pérez, Gilberto Guevara, Ramón Gómez, Marian Jolie, que tuvo muchos sombreros en el meeting de este año, la profesora Aquino, Michelle Rivera, Chandra Justicia, Giovanna Guerrero, Margarita Irizarry, Rafael Tosado, Carlos Malavé. Todos ellos han estado de revisores de los abstracts y de las presentaciones orales de los estudiantes. Muchísimas gracias a todos. Si me olvido de alguien, me disculpo. Ha sido mucha gente trabajando para hacer este evento una realidad. Y gracias a los que nos están viendo, y por favor sigan a AAAS Caribbean Division por las redes sociales. Van a haber más eventos durante el año. De hecho, hemos estado este año, durante la pandemia, muy activos. Prácticamente todos los meses tuvimos un evento, un Science Café o un diálogo sobre algún tema de importancia. Síganos en las redes sociales y compartan su ciencia y sigan haciendo historia. Muchísimas gracias por todo y buenas tardes. Chao.